All right, so we're going to start off this morning with our panel discussion on the case of Tanya. And before I share my screen with the case study, I do want to introduce our lovely panelists that we have today. So we have Mr. Tim Tate, if you would like to introduce yourself a little bit.
Hello, my name is Tim. I'm a licensed professional counselor. I graduated from TAMU-CC. My first job out of the chute was working with juvenile justice, doing multi-systemic therapy. And after that job for 3 years, I went on to MHMR, where I met Jimmy. And thankfully, that's the only name I ever had to call him. So I'm just going to keep it as Jimmy. And that was such a great experience because that prepared me so much for what I do today, working with youth and families. So what I do now is I work in a doctor's office. I work at South Texas Mental Health Associates. I work with Dr. John Lucens and a staff of psychiatrists and nurse practitioners. And I've been there for about 9 years.
Awesome. Thank you so much for being here today and for introducing yourself.
Thank you for having me.
Of course. And our next panelist is Angela Ramirez. If you would like to introduce yourself a little bit.
Hi, so I'm Angela. So I recently got credentialed as a PMHNP this past July, but I've been working inpatient at Bayview Behavioral Hospital. I primarily charge on the adolescent unit. And I actually just put in my resignation about 2 days ago. Me and one of the psychiatrists are opening up an outpatient clinic. So I'll be starting that later this month, and I'll be seeing, everyone through the lifespan from child to gero. So I look forward to that. I've only worked in the psychiatry field. I've never done anything else nursing wise. So I've been doing that a little over 8 years, and I look forward to the new journey.
Awesome. Well, congratulations on your new career path, and we're happy to have you today.
Thank you.
All right, so I'm going to go ahead and share my screen with the anxiety case study that we're going to be going over today. And I'll make this a little bit bigger in case anyone needs help in that area as I do. And I'll go ahead and read our case study, and then we'll start off with our questions for our panelists. So Tanya is your client and or patient in this scenario, and she is 38 years of age. She identifies as cisgender female. She is African American and non-Hispanic. So Tanya comes to you as a single mother of 2 boys who are 14 and 17. She shares that she and her husband were happily married before he passed away in military combat about 13 years ago. And since then, she has become accustomed to single parenthood, and she and her sons are close. She's financially stable and works in a managerial position at a successful business firm where she is responsible for a team of about 12 coworkers. Her coworkers describe her as dedicated and focused, but also nurturing when it comes to professional development of her team. She's often very busy at the office. She works very long days, often 12-hour days during a regular work week. And she discloses to you that although her work is very stressful, she also finds a good deal of meaning in her work, and she generally enjoys her job, even with all of its challenges. As you explore Tanya's reasons for coming into the clinic, she discloses that she has been feeling pain in her chest recently, and that the pain has been increasing in intensity and duration over the last few weeks. Tanya states that she used to have this feeling in her chest when the pandemic first began, and that it was happening at least 2 or 3 times a week for a while, but she attributed it to heartburn because she had poor eating habits at the time, because she's always on the go. She also mentions that when her work transitioned to remote work as a result of the pandemic, she began exercising, spending more quality time with her family, and eating healthier in an effort to improve her and her boys' overall well-being, because of a lot of the health concerns associated with the pandemic. In addition, this seems to have solved some of her chest pain problems, but when she returned to work in person about 8 months ago, the chest pain slowly started to return. Tanya is generally in good health. She's a healthy weight, she has good blood pressure, she doesn't take any medication, and she has no prior medical issues. She does disclose to you a history of heart problems on her father's side and a history of diabetes on her mother's side. You notice that Tanya seems very keyed up during your meeting with her because she has difficulty sitting still, she seems really tense, and she speaks very quickly. So you ask her if she's anxious or worried, and she replies, "Oh, constantly. I feel like a cat on a hot tin roof. I can't remember the last time I felt relaxed before the pandemic." So you ask Tanya about her and her family's mental health history, and she explains that this is not something that was generally talked about in her family, so she hasn't given it much thought. Upon further exploration, you learn that Tanya constantly feels worried about anything and everything, more so than she used to worry. She also shares that she has difficulty concentrating, she has a hard time getting to sleep and staying to sleep. She often feels very drained. You also learn that Tanya experienced the death of several close friends and some extended family members who contracted COVID during the pandemic. She explains that this has contributed to a lot of her concern about people who have stopped wearing masks and seem to go out very frequently, and just overall are kind of acting like the pandemic was not an issue and it's not a concern anymore. As Tanya shares her concerns, she begins to feel chest pains, and she states that she feels like she's having a heart attack. Her eyes are wide with fear, and she complains of difficulty breathing, and you notice that she begins to sweat. At this time, you recognize that Tanya is experiencing a panic attack. So, our first question for our panelists is, what is your clinical impression of this client, and what would your first steps be in assisting the client?
So who's first?
You're welcome to go first, Mr. Tate.
Okay. So of course, it absolutely sounds like anxiety. It could be panic disorder. It could be PTSD. She could be high functioning depression. I mean, there could be a lot of things. So it's probably going to take some more time to get more information. But absolutely, what I want to do is identify, what's causing her anxiety or her panic, and what she can do to control that, regulate that. So I'm going to, well, first off, what I'm going to do after hearing what she has to say, and that's probably going to take a lot of our first session, I'm going to give her something to do, a couple things to do. I want her to be able to evaluate herself using a simple rating scale that I use with clients. It's a 1 through 10 rating scale, 1 being the worst, 10 being the best. So I want to know where she's at between a 1 and a 10. And people usually ask, "You mean right now?" Yes, I mean right now. Like, how are you between a 1 and a 10? I probably would want to find out after she's calmed down, or what she would have rated that. We would have gotten her calm after she experienced that attack, helped her calm down, and then probably had her identify where was she at on that scale, because I want her to track. I want her to be able to see what's causing her to go up and down. And I want to explain what that scale means. So if 1 is the worst and 10 is the best, then somewhere in the middle, which is about 5 or 6, the space between 5 or 6, that's okay. And I always want to be at least okay, because if I'm not okay, if I'm not a 5, I might be a 4, which is less than okay. A 3 is worse than okay. A 2, if I'm experiencing a 2 for very long, then I might need to see a doctor. And if I'm experiencing one for very long, worst day ever, like the panic attack just will not stop, that's when I might need to go to a hospital. And what doctors, and this is what I explain to clients, is doctors and hospitals, what they're going to do, their primary focus is to stabilize you. So they're going to probably use medicine. And that medicine can help you get up to a 4 or a 5 if you're lucky, so that you're able to do things for yourself that you might not have been able to do otherwise. So the more you're able to do things that are good for you, things that you enjoy doing, the higher up on the scale you can go. So above a 6, 7 would be better than okay. 8 would be pretty good. 9 is awesome. And 10, best day ever. That's for special occasions. We're not going to put pressure on ourselves and think that we're supposed to be 10 all the time. It's not realistic. So I want clients to know where they're at on that scale, what's causing them to go up and down, so they can start to assess themselves. And then eventually they'll be able to, we'll working together, figure out what they can do to treat wherever they're at to get them higher up on the scale. So if someone is at a 4, we're not going to try and jump up to an 8. We want to identify, what is it going to take to get from a 4 to maybe a 5, right? We don't want to overwhelm people and think that they have to be high up on the scale. We just want to get up, what is it going to take to get to that next level? So other than that, it sounds like anxiety. And something else I'm going to do that maybe we can get into a little bit later is I'm going to teach her some mindfulness, an introduction to mindfulness to help her practice calming down, because usually the case with anxiety and panic, people are blowing things up and they do it so fast and so automatic, they don't even realize that it's happening. So I want to give her a practice in calming herself down, but that's going a little bit outside of the evaluation. So I'll stop there.
So do you want to add anything, Angela?
Yeah, so I agree with Tim. You have to establish that baseline. I would definitely give her maybe PHQ, a depression scale, and then a GAD, anxiety scale. But I also think that it's important that when a patient presents with anxiety, yeah, like, the case, it totally looks like anxiety, and I know it says that she has no prior medical issues, but it's important to rule out, the medical cause. When is the last time she's been to her PCP? When's the last time she's got her blood drawn? Could this be something else that's underlying? We need to look at the family history, like heart problems. What if she has hyperthyroidism and all of this is related to that? So it's important not to get so caught up in, oh, this is just anxiety. So.
And if I could add, how would I assist my client? I want to educate my client. I want to help my client get a better understanding of what's happening. And what's happening doesn't mean that there's something wrong with her. Actually, it means that there's something right with her. Her body is responding to some kind of threat, whether it be real or we're just, creating something in our mind. So I want to establish that what she's feeling is a physiological response, and it makes sense. It sounds completely normal. So there's absolutely something that can be done when you get a better understanding of what's happening. And what I like to tell people is, just broadly, mental health, just a basic, simple definition is your mental health is how your thoughts affect your emotions, which affect your actions, which affect your thoughts, which affect your emotions. So I want to give her like an understanding, a real basic understanding. I want to make it as simple as possible, because I like to go with the KISS acronym. I don't know if anyone's heard of the KISS acronym. I actually learned it as an undergrad out there at TAMU-CC. And back then it wasn't the nice version. Since then, I've learned the friendly version, which is keep it super simple. So I like to keep everything super simple with clients, because usually they're coming to us with a complicated issue. So if I can give them simple ways to approach things, they're more likely to do it. So I want to explain to her that your thoughts, your emotions, your actions, it's all energy, right? They say emotion, this anxiety is an emotion. I would help her identify that that was an emotion. Emotion is energy and motion in your body. So this energy that you got, it can be changed into something better. Because the thing about energy, what Einstein said, you can't create or destroy it, you can only transfer it. So if you've got what it takes to feel bad, you've got what it takes to feel good. We just need to transfer that energy to feeling better. And then we can talk about the things that she can do to help herself feel better, because that is the treatment plan for the client, is what they can do to make themselves feel better.
Awesome. Thank you both for that. So as we're talking about this client, and as you're reading the case study, we're wondering what protective and risk factors did you notice about this client?
So protective factors, supporting factors. So I use my approach, my plan, and kind of my template that I use for all my clients is I have this holistic approach of mind, body, spirit, and I know if something is happening negative, and from your mind, body, spirit come your thoughts, emotions, and actions. So if something is off in the thoughts and the emotions and the actions, I can probably find it somewhere in the mind and body and spirit. And something's out of balance. If people are too much in their mind, it can cause something in the body to go off balance. Spirit is about relationships, it's connectivity. And it's not just with a higher power, it's with your higher self, it's with other people. It's all about relationships. So that's where I'm going to go to identify who her supports are. And it sounds like she likes work. She's close with her kids. That's good. She's lost some family. That's we want to take a look at that, and friends. But then maybe how she, I don't know if she goes to church. That could be. I want to find support for her, whether it be through church or grief support. So I'm going to start to take a look at that. Potential risk. Should I just go under risk factors, or? Okay, so risk factors is just basically she's out of balance as far as she's not taking care of herself the way that she was. There was a time when she was doing things that are, that were good for her, and she saw improvement. So helping her identify that she can get back to that, it's possible, but it's identifying all of those things that probably had her higher up on that rating scale, and how can she implement those again. But start off slow. We don't want to overwhelm. But definitely, if she's back to that 12-hour workday, and she's stressed at work. And then what's her work-life balance? If you have a stressful job, what are the stress relieving activities? And again, reminding her that she's done this before, and it can be done again. It's just going to take some figuring out, some planning. But then again, further testing, diagnosis as far as if it's panic or PTSD. I work with people. My specialty is anxiety and depression. If it's something outside of that, and I also only work with adults. So if it's child related, I'm probably going to make a referral. Or I will make a referral. So if it's outside of my scope, I'm going to refer. If it's PTSD, I have a trauma focused therapist I'm going to refer to. So, but between the time that I refer her, maybe even to see one of my nurse practitioners that I work with, I'm gonna help her come up with something she can do in the meantime, and we're gonna continue to meet until she gets to that next person.
Angela, was there anything you wanted to add?
No.
Okay. So our next question is, and both of you have kind of touched on this already, but you both have very different kind of priorities in mind because of your professional training. So what treatment approaches might you take with this client? And let's start with you first, Angela.
You know, so like you said, like I said earlier, I think it's important to, you know, rule out those medical issues and make sure she sees her PCP. But, you know, also on my end, you know, she still kind of needs help, you know, for the moment. Like what are we gonna do, you know, right now? You know, she might need some like PRN medication, and I might start her on like a low dose antidepressant.
Okay.
Recommend, of course, you know, recommend, you know, therapy
Right,
and
right.
and some lifestyle changes.
Okay. And so how would you follow up with Angela, and what would be your treatment approach, Tim?
So I like to tell people I can't prescribe medication. I can only prescribe meditation. So I teach all clients mindfulness, at least an introduction. I bookend my sessions with a three breath mindfulness practice, breathing in through the nose for 4 seconds, holding the breath for 4 seconds, and breathing out for up to 8 seconds, because that's going to help her activate her parasympathetic nervous system and her ability to calm down and relax. And I'm going to explain that to her and how that works. And I'm probably going to send her a video that's going to emphasize that. I really like the Dan Harris mindfulness videos. If anybody's seen those are great. So, and I'm going to check in with her on that. I asked people to do that practice, the 3 breaths, 3 times a day, like morning, afternoon, evening, and come back that next week and let me know how that is. Tell me what that's like. And then if they're interested in nurturing a practice, then we'll start to increase by doubling up and then adding a minute every week until they get to maybe 10 minutes. Not all clients want to get to 10 minutes, but people do find just that breathing practice, just the 3 breaths, helpful. So I'm going to give that for her to do, and then help her identify things like exercise. And hopefully talking about this is helping her. So I want to encourage, you know, more communication. So in my treatment approach, I'm going to look at using my template of mind, body, spirit. I'm going to check in with someone, how someone's communicating, how they're continuing to educate themselves. Like, you know, what's, you know, is she's worried about the pandemic? Is she just watching like bad news all day? I mean, what else is she doing for her mind, to keep her mind active and fit? So opportunities to read and watch videos, helpful videos, you know, whatever makes sense to her, what she likes to do. So I'm going to focus on more honest communication and how can she increase that, more education. And of course, I'm not going to lay on all of this on her at once. I'm just going to hear opportunities, because we never ask anybody to do anything extra. We just ask people to do things different. So we don't want to add more stress to whatever they're doing. So I'm also going to look at physically, like nutrition, exercise or not, and sleep. what does her sleep look like? What is her sleep schedule? Is she on a good schedule? What's sleep hygiene like? Because that affects everything. That's the foundation. Without that, everything crumbles. And then, of course, back to her connections with something outside of herself, something greater than herself, higher power. She goes to church. Her higher self, getting in touch with that part of her that always knows the right thing to do, but a lot of times we know what to do, but we don't feel like doing it, and we give in to something else instead, and we end up regretting it. So I want to find out what that's like for her, and then of course, who are the people in her life that see her, hear her, and validate her.
So Tim, I wanted to ask you something before we moved on to our next question. Whenever you were talking about, some clients don't want to get to the 10 minutes. I know one of the challenges of being a counselor, right, is sometimes we have clients that aren't really willing to put in as much work as what we hope. And so how do you work with clients like that are maybe a little bit more resistant to doing the things?
Resistance. Well, usually that's like a second session. we get into resistance because I'll ask people, and that this is always, this is also giving me information. If I ask somebody to do three times a day, and they come back and they tell me they didn't have time to do that at all. It takes less than a minute, and you didn't have time to do it once a day. So I want to start to kind of look at that. And then there's other people who say they did it like many times a day. But we always want to find that one time that's the best time to increase more time. So the second session is something usually comes up that I can introduce this resistance versus acceptance. And again, helping people understand that a lot of times, especially if I hear someone say that they're stuck, that they can't move forward, I know that there's resistance going on. There's some kind of wall up. So I like to talk to people about that and identify, if you're resisting something, if you're saying no to something, or if you're saying something shouldn't be the way that it is, then you're basically creating a wall. And then you get stuck behind that wall in that anxiety or depression or anger or whatever the issue is, right? So if you want that wall to go down, then the opportunity is acceptance. And acceptance doesn't mean that you like what's happening. It doesn't mean you agree with it. Doesn't mean you want more of it. It just means you're recognizing it so that you are able to do something about it. So that in itself is homework for clients, is having them have this simple acceptance practice, like throughout the day, and how many opportunities do we have these days to practice acceptance? I mean, how many difficult people and situations might there be, in the day? So lots of opportunities to practice acceptance and strengthen that acceptance muscle, because this resistance has probably been going on for a long time. And I like to explain, even if we resist our emotions, we shouldn't be feeling this way. Because what happens is, here comes an emotion and I'm saying no, and here it comes and I'm saying no, and then I'm just strengthening it. So I want to help people understand that by resisting, you could be strengthening something that you don't want. But getting into acceptance, which is just the other side of that, might help you to feel better, to move forward, and learn something new. So I don't know if that answered the question. Just getting them showing them that there's another side, right? If resistance, hasn't been working for you, if you can identify where you've been resistant, and give them a practice to do something different and try that out and see what that's like. That's where I might go with that. I think Angela was going to say something.
No, okay. Yeah, that definitely answers my question. So I appreciate that. So moving forward, and I know we've kind of already talked about this a little bit, But what other information would be helpful for you, or for, I guess, for both of you in your respective settings, as well as what kind of assessments would you be giving this client, if any?
I mean, you definitely need to rule out, your differentials. A lot of people, have, um, along with anxiety, MDD, for instance. So you need to, you're making sure you're not so much just focused on the anxiety, but kind of, everything. Um, uh, just mood in general. There's so many different things to assess for. And earlier I did talk about medication, but I think it's also important that patients know it's not all about medication. Like just taking a pill isn't going to solve all of your problems. Hence, like what Tim's talking about, it all comes together. Um, you know, taking a pill is not going to solve everything. You got to dig deeper than that.
Yeah, so since I work in a doctor's office, the explanation is, if you take medicine, that's 50%. The other 50% is finding out what you can do for yourself, so that hopefully, maybe one day you can decrease the medicine as you're increasing the things that you can do for yourself to help yourself feel better. Which, like I said, outside of anxiety and depression, I'm not going to go further from that. I'll probably refer for assessment. Of course, I know a psychologist that I refer to. But the main assessment I wanted to bring up, the simple main assessment, and I think it's the big question in a first therapy session, is asking the client, are you easy on yourself or are you hard on yourself? And I think in my 9 years of private practice, I've had one person say they were not hard on themselves. Because absolutely the way, and you help someone identify, what does that do? If you had a friend who wasn't feeling good and wasn't sure about things and didn't know what to do, would you be hard on that person? And the answer is always no, of course not, because they wouldn't want to make anyone feel worse, right? But a lot of times that's what we do as humans. So when you start to understand a lot of this, the potential in therapy, I think, is learning how not only to treat yourself better, but to become your own best friend. So treating yourself like a friend, like how would I treat a friend? I wouldn't tell a friend, you're not okay, this is not okay, it is never going to be okay. You're going to tell a friend, it's okay, you're okay, it's going to be okay. You're getting someone to see that they could have that relationship with themselves is a big game changer. So I just wanted to mention that.
And I feel like I kind of left out something important. Part of your assessment, number one, is safety. I mean, is she safe? Is she suicidal?
Absolutely.
So safety, number one.
100%. I send a questionnaire to clients. I use Simple Practice. It's great. Simple Practice sends out a questionnaire, email that people fill out, send right back, and there's already questions. Have you thought about suicide? Have you attempted in the past? So I already want to get an idea of what to do about that and how to help that person come up with a plan if necessary. Absolutely.
Yeah. And, it goes back to like the protective factors, like who's their support system? Do they have anybody they can talk to? Do they need to be referred out to like a support group?
Yeah. And do they have a number? Do they have that 1-800 number to call just in case? Or they can always dial 911 in case of emergency. Yeah.
Wonderful. Thank you for those considerations. So my next question is more kind of on the topic of integrated care, and it's kind of a two-parter. So the first part is, if you're working on an integrated care team to assist Tanya, what would be your role and responsibility to her? And then my second question is, as part of that integrated care team, how would you collaborate with other providers to make sure that Tanya gets the best care she can receive?
So I feel like this can be like a tough situation, but you're saying like hypothetically, if I was part of an, I guess I feel like these days, like people don't want to talk to other people. They just want to like do their own thing. It's like, I don't have enough time. So I feel like other people need to be open to doing this, like first and foremost.
Yeah. So I'm lucky that, well, not always, but if I have a client that's a patient of one of the nurse practitioners or psychiatrists that I work with, that there's a consent form, always a consent form. And I can talk to them about, medicine, but, I might using my, mind, body, spirit, are they, is there support group? Is there church? What are activities? What are, health, physical, exercise, nutrition, or is she finding out more about that? So I'm going to, have some kind of, if I'm not communicating with those people directly, I'm going to find out what she's doing. And of course, I'm going to keep checking in with her on progress in all those categories.
I mean, I think
like a kind of accountability.
yeah,
How's it going? I'm sorry.
I think it's important, to, like you said, ask them all those questions, like, what are they doing? Like, what are you doing different? You're trying to be better. What are you doing different? And sometimes they need to get pressed about it because they don't want to do something that's, change is uncomfortable. And, we have to give them that like little push. But Tim, like, you're lucky, to be working, in a group like you are. And, that's the plan for me too, have like therapists in-house. And that together is just, I mean, I'd love to work in a place like.
Yeah, and if we could get people out to like yoga classes and anything else that they can do outside, group, anything. There's a great opportunity every Saturday. It's going on right now at Water's Edge Park. The city pays for group classes. There's a group fit, there's a yoga class, there's a Zoom class. It's everybody's welcome, and it's all paid for by the city of Corpus Christi. I help them identify opportunities if they can't afford that. There's a lot out there. So we're just going to help them find it if they don't have it already.
Yeah, like resources are so important. I feel like, I'm just barely fixing to start, practicing, and that's one thing I'm like, oh, like resources. Like, what am I gonna tell them? Like when they ask me, counselors or groups or this or that, it's like, well, where are my resources? I need to have a good resource list compiled.
Yeah. So we have on Facebook for therapists, it's a psychotherapist support. I don't know if they call it support, but everybody could use a support group. Kids, teachers, parents, everybody. So for therapists, we have a Facebook page, and we also meet once a month, first Wednesday. So that page is somewhere I can go. Like if I need to find somebody that, I have a client or I can't see somebody, if it's a kid and I can't see that kid, but I know what's going on, I can kind of give a brief description on that page and I can get a referral like that. So identifying, yeah, your supports, your resources for sure.
So are you talking like local counselors?
Yeah, it's a Corpus Christi therapist page, Facebook.
Cool.
If you want to find, Corpus Christi psychotherapist, I have to look it up. Maybe I can send the link to someone and get it to you.
Yeah, we'll definitely follow up with any resources that either of you would like to share, and we can send those out to our TexCHIP group.
Sure.
So I know y'all kind of just touched on resources, but are there any more like specific outside resources that you would recommend for this client?
Church. I mean, does she go to church? If not, family, friends. I mean, who are, I mean, she's healthy. She's not taking medication for anything, but of course, checking, like Angela said, like on her most recent doctor's appointment, just, and if there's opportunities there, if she needs to address anything, I'm constantly thinking mentally, physically, spiritually, like what are the opportunities?
You know, I think she might need hey, have you taken some PTO? You might need a break.
Yeah, identifying that balance. There's some out of it that's she's overworking, and maybe she's overworking, who knows, to avoid, to compensate. Seeing what kind of balance might be going on or out of balance, and yeah, too much work and not enough time to recover or relieve herself of that stress. You know, it's stress. It's what we say is, you know, stress is just a part of life. It's actually a necessary part of life. But if we don't manage it, then it can become anxiety. And it's usually anxiety because we're making something out to be worse than it is, or we're not dealing with it. And then ultimately that can become panic. So I want to find out, yeah, how she's managing stress so that it doesn't in any ways that she can do that. And I mean, the most simple way is to go outside, go for a walk. Best exercise and best medicine, because if you're going to be thinking about anything, do it while you're moving. And even better if you've got someone to walk with and talk to at the same time. So helping her find just people close by that are easily accessed, keeping it simple.
Wonderful. So our last question, we've kind of touched on it a little bit throughout, but Angela, I'll start with you. How would your approach or your work with this client change if Tanya were an adolescent?
I mean, I don't know necessarily how it would differ. I mean, I would basically treat the symptoms how they're feeling kind of the same. But you know, just maybe, you know, different recommendations, like sports, like recommending sports or something like that. I guess it's just kind of I feel like the question's kind of, you know, difficult because I guess I don't know exactly what you're looking for, and it would basically be about the same approach.
Yeah. And it's not meant to be like a trick question. From the medical side, maybe it is kind of the same.
Yeah, and you know, with the kids, and it's also it's important to not overlook it in adults. I mean, you know, ADHD and stuff like that can, you know, adolescents and children can present, you know, differently, with different diagnoses. Um, so that's just something to be mindful of.
So Tim, I know that you kind of said already that working with adults is really your specialty. Is there anything that you might be able to do for an adolescent who's in your office, or what would your approach be?
That probably wouldn't happen, like ending up in my office. I mean, that would have, like, what would happen if someone's going to call me and they say that their son or daughter is experiencing something, and when I find out the age, I'm going to refer, and I have my referral, I have my group that, you know, whatever insurance, whatever issue, whatever age, they have a therapist for that individual. But of course, if I'm talking to the parent, that's where I'm going to go, is, you know, how can I help the kid by educating the parent? So maybe the parent is interested in finding out what they can do to help their child. And again, that would be the education and support for the parent, because that's key in helping the child.
And I think something like I would like to add is, you know, when it comes to children and adolescents, it's always important to talk to your patient, which is, you know, the child or adolescent. Just because a parent is saying this, and that, you know, working with children and their parents can be very difficult. Like, I need to hear what, you know, this kid has to say. So it's important that they have a voice.
Yeah, absolutely. Thank you for sharing that. So I'm going to go ahead and stop sharing my screen so we can all see each other. And if any of our TexCHIPers or community members have questions that they would like to ask, you are welcome to ask at this time.
I'll go ahead and go first. And good morning to everybody. So right off the bat, I want to say hi and thank you to Tim. So for those of you, all of y'all have been in my cohort, so y'all have heard me talk about my experience with therapy and how I got to where I am. He's the reason I'm even here today. And he's the reason that y'all even hear me always talk about this book, the 4 Agreements. You can, if you like it, you can thank him. If you don't like it, you can blame him. Anyway, but one thing I would like to kind of ask for both speakers today is, based on the theoretical orientation y'all would approach with this patient specifically, what specific homework would you like to send them home with after your second visit? Because we've already talked about initiating the patient, getting the basic information. Second session would be dealing with resistance. Now that you've dealt with resistance, what are some homework items you would want them to work on and complete before your third visit? And I was getting kind of micro specific, but I think that's procedurally a good way to kind of see how y'all would take this.
So at the same time, and it's usually a second session too, I'm also teaching people that cognitive triangle. I walked in on that my first day at MHMR, and when I saw that and it was explained to me how simply, you know, that's mental health right there, and helps people understand you know, where their emotions are coming from and what they can do about them. So I'm constantly going to be checking in on, you know, where their thoughts are and what they're doing and how that's affecting the way that they feel. And of course, the things that they're doing are things that maybe we've identified in, you know, the first couple of sessions. You know, they're maybe exercising more, or they're reaching out to community more. So I'm going to check in on that. And then of course, the mindfulness, if they're nurturing a practice, then we're going to be doubling up each time. So I'm going to, well, the first session, the first week is 3 breaths. The second week is 6 breaths. So we double up, and then every week after that, we add a minute. So I'm going to check in with them on that. And just the constant, you know, how are you treating yourself? What's, you know, are you working on, how is that? How are you doing working on treating yourself better? Yeah, specific homework, it would depend on the individual, but overall, it's always going to fall into that. Yeah, how are they thinking? Where are their thoughts? And what can they do to improve those? and their actions. Yeah, so that's going to be kind of an ongoing.
And for me, Matt, in a way, I feel like it's kind of a difficult question for me to answer because everybody's different, and I just kind of like to go with the flow. And, just because it's the second or the third visit doesn't mean that they're all good. There could be like a new crisis that has come up, and, we need to focus on that.
And I may have worded that poorly because I meant it specifically to the case conceptualization.
Yeah.
So when we're dealing with Tanya specifically, what are some homework things y'all like for her? Because I know the general like cast a net out there is that's way too vague and way too obtuse.
So it's the emphasis that people come to see us once a week, right? They might see us once a week. If they're under a 5, if you're under a 5, I want to see you once a week until you get to okay. And then the higher up on the scale you go, the further out our meetings. So I want to make sure you're doing something in between our meetings, and I always want to know what that is. And I'm thinking, so books, I would definitely, if someone asks me a book, that's probably one right off the top. Or maybe there's a lot of Brene Brown stuff going on right now. There's YouTube, there's Netflix, now there's HBO Max series. So things that they could be doing, which could be enjoyable. The things that we want to make the things, their homework things that they like to do. This shouldn't be difficult. Treating yourself better means doing things that you enjoy. So helping them find the things that they like to do and check in with how they're increasing, and increasing that and decreasing the stress in their life.
Yeah, I mean, I totally agree. With her, it sounds like she's busy being a mom, going to work. Like, what are you doing for you? If you don't do something for you,
Yeah.
it dominoes negatively
Yeah.
in other aspects of your life.
Yeah. But not just physically, but mentally. Like, where are you in here? What's going on in here?
Yeah.
And so I give I identify with people on that triangle. There's positive thoughts, there's negative thoughts, but I'm not going to tell everyone that you just need to be positive all the time. That's not realistic. And toxic positivity and all that stuff. I want to identify there's some middle ground. There's this neutral way of thinking, which is more honest and more realistic. And so I have like a sheet of realistic self-talk that's going to be different statements that they can use every day that's going to help them like identify, okay, this is a neutral, realistic, honest way of looking at this, because a lot of times, we're blowing something up or making it out to be worse than it is. So I want to help people kind of bring it back and do that different. So I'm going to give them like, the handouts. You're supposed to get a handout whenever you go see a therapist. So I guess, these days we email them, but something that they have to do every day as practice. So yes, there's always going to be something ongoing that I'm checking in with them on.
I think it's also important that our patients and, even for ourselves, just because we have children, it doesn't make it like selfish to do something for ourselves. And I think a lot of people, they get caught up in that. It's like, oh, well, everything is about the children. I'm just selfish if I want time to myself. I'm selfish if I want to do this or that, and it's important for people to know that, like, no, it's part of your self-care and it is important.
Especially mothers, especially single mothers.
Yeah.
Because that is definitely, that's an assessment that I would want to do. Another simple assessment is, a lot of people are very extreme. They're either they're focused on self too much, or they're focused on others too much. Like a lot of people will say, I take care of other people, and I don't do anything for myself. And that's when we remind people, you got to take care of yourself first, just like the flight attendant says. You've got to put the mask on you first, even if it's your child sitting next to you. So what does that look like? And it's not self-serving, it's self-caring. And a lot of the homework is self-care. It's just taking better care and helping the clients identify what that is and what that looks like every day.
Awesome. Thank you all for that, because I mean that's essentially where I was wanting to get it to, because I think when we have so many projects and papers and such, we automatically as students turn to the standardized stuff that we can find on, whether it be like therapist aid or something like that, to put together to that we think is going to be right. But I think as y'all talked about, kind of thinking a little bit more outside of the box and more directly relational to them and what individually makes them happy are some things that we don't often consider when crafting our papers or our projects and things like that. So it's good to hear y'all's perspective on how y'all approach those individual patients.
Thank you.
And like even like now in my life, I've been trying to work on myself. I'm telling my clients do this and do that, and I need to work on myself and practice some of those things that I preach. So
Oh yeah, there's a lot of times I'm telling a client something, and at the same time I'm thinking, are you listening to what you're telling this person? Because you could probably do that too. Yeah.
like, you need to go see a therapist, and I'm like, Angela, do you need to see a therapist?
We could all, yeah, benefit from seeing a therapist or finding a support group. So yeah.
All right. Well, thank you both for a wonderful discussion. I do want to be respectful of your time. So if either of you have resources that you'd like for us to share with everyone, please feel free to send those to us and we'll make sure that those get distributed. So thank you again, Angela and Tim. And at this time, for our TexCHIPers and anyone else who would like to stay for the Coping Cat curriculum training, we're going to take maybe a 15-minute break, and then we'll come back at about 10:15. If anyone else is not interested in staying on for the Coping Cat curriculum, you're welcome to sign off at this time.
Okay.
Good luck and everybody have a great day.
Thank you.
Thank you.
Hey, Ashley. Hey, so I was gonna send you my paperwork on Monday.
Okay, yeah, no problem.
I haven't sent you anything, so okay.
All right.
Thank
Bye,
you.
Angela.
Bye, y'all. Have a good weekend.
You too.
Thank you.
Yeah, I'm just gonna leave it playing because it's.
All right. Well, welcome back, everybody. I'm going to go ahead and I'm going to get started now. So you're stuck with me again. Sorry, but I'll do my best, to work with you all and help you out so that you can understand this curriculum. And I've used this curriculum many times. In fact, it's still the recommended treatment approach at our local mental health authority, MHID, and all of the respective counties throughout Texas. This is the recommended treatment for youth primarily with anxiety disorders, and for adolescents it's the coping cat. So I'll show you. So we're going to be going over the coping cat curriculum today, and you have the therapist manual, and I don't know if y'all can see it because of my background. You have the therapist manual. Let me fix that. All right, so you have the therapist manual, and then you're going to have the workbook. And this is made by Philip Kendall. And I do have a digital version of this workbook for the presentation. I don't have it for the manual. So hopefully you all have the manual. Hopefully you all were able to pick up the manual. All the TexCHIP students I'm talking to, hopefully you were able to pick up the manual. And then the workbook would be something that you would have. Actually, the workbook is what we had available to you, but the manual is what you would have to get on your own. So, oh no, I'm sorry. We had the manual accessible for you, but the workbook would be something that you'd have to pick up. So the workbook can be found on Amazon. It can be found on different websites. So I would encourage you again to pick that up if you haven't already. But that's what I'm going to do now is I'm going to share my screen and we're going to go over the workbook. So the workbook. Oops, did I share that right? This one, there we go. Yeah, can y'all see the Coping Cat workbook now? Excellent. So the workbook is a 16-session workbook, and it's made primarily for children ages 7 to 13. Now, if you have adolescents who are older than 13, you could still use the workbook. But they also have what's called the Coping Cat Project, which is this one, which is primarily used for 13 and up, like 13 to 17. But it actually follows the exact same session format. It's just that maybe some of the scenarios and some of the questions are more geared towards adolescents. But otherwise, the same principles are at work, and it's very helpful. It's a very good curriculum to use. So I've had a lot of success with this, and it's again primarily for young children with anxiety-related disorders and symptoms. Oh yes, and thank you. Actually, the links to the manual are found in the TexCHIP website, where you can go and purchase this curriculum. So So like I was saying, it is made by Philip Kendall. He's the author, and it's been around for a while. It's been around since like the early 90s, and then they've made several revisions to it. So the manual that I strongly encourage everyone to get, we're in the 3rd edition for the manual. The workbook is in the 2nd edition. It's been revised in the early 2000s. And again, it's still the recommended treatment approach. So it's very, very helpful. It's been, there have been several research studies that have been done to show its efficacy as well. So, so this workbook would be something that you typically would give to a client. Now, if you have a caseload of like 20 clients and 10 of them have anxiety disorders, you know, and you work with youth, and you know, it can be a lot. So you can still make copies of these workbooks sessions, and I like to make copies for clients and make several copies of the sessions ahead of time so that they can bring it to session with them when we work on these things. But you can give them a workbook to take home. That's ideally what it was designed for, is for them to have their own workbook, and they can, you know, take it home and work on these things, you know, outside of home or outside of session or in session. So here are the table of contents. And so the table of contents that's listed in the manual is worded and named differently because the manual expands upon what you're actually doing. The workbook is very simple to read and to look at. It's made for children's eyes, right? And so it's very easy for children to understand, but the manual has a lot of content that'll take a lot of time for you to study and read. So that's what I definitely encourage you to do, is take your time studying and reading this manual. And by the way, Philip Kendall and his website has resources that they have DVD content, like where you can get training materials to really accurately implement this curriculum with your clients. So the first session is an introduction. Basically, you're going to be building rapport, and you're going to be orienting the client to treatment, orienting the parents to treatment. Then session 2 is recognizing feelings, identifying anxious feelings, how to recognize that. Session 3, how does my body react? This is where you're going to identify somatic responses to anxiety. So what does my body do? What does my heart do? What's my breathing like? What's my muscle tense rating like? You know, so you want to, you know, orient them to that. And then you have a session with parents. And then you go on and you continue practicing these skills, and you go on to help them in session 5 with more relaxation training. And this can be like helping them with progressive muscle relaxation, visualization exercises. They primarily have like you know, relaxation techniques in there for like robot ragdoll, they call it, which is kind of like a progressive muscle relaxation exercise, but it's kind of worded for fun for you and the kids to practice. And then we're going to shift from recognizing what my body feels like, recognizing my symptoms for anxiety, to what am I thinking? What is behind my feelings? What's behind my behaviors and actions? So here you're helping them recognize thought patterns, especially identifying anxious thoughts, anxious self-talk that they do. And then you'll educate them too on some thinking traps. So I'm going to go into much more depth on each of these when we continue. And then you introduce how they can evaluate their ability to recognize their bodily signs of anxiety and to recognize the thoughts that they have that's behind their anxiety. So this is a very CBT oriented cognitive behavioral treatment. This is a cognitive behavioral strategy, and the framework is implementing evidence-based strategies that have been studied to show its efficacy. And so in session 9, you have another parent meeting, and we'll go into why that's all important. Session 10 is now where you're going to be practicing low anxiety provoking situations. Now we're going to kind of follow a progression of like systematic desensitization, where we're going to gradually explore anxiety provoking situations while we're still helping the client recognize how their body's reacting, while we're also helping them recognize what they're thinking, and then how they can take action to cope with these anxiety provoking situations. And we're going to explore strategies for that as well. And then you get to the where you practice some more now. In session 12, it's more practice, but it's practicing moderately anxiety provoking situations where these anxiety provoking situations now actually might cause some unpleasant emotions and unpleasant responses. And you're going to help them record for themselves, like, what is my body doing now? Like, what do others observe about my body? What do I observe about my body? What do I observe about my thinking and my response to these anxiety provoking situations? That I have. And we'll talk about that in a second too. And then you practice high anxiety provoking situations and exposure tasks. So this would be where it gets tougher. And they practice these skills that you train them to prepare for. They practice it in session with you. You do a lot of modeling in this curriculum because you really want to help them see that they're capable of coping with various stressors that it is that they worry about. And there's a big emphasis on reward, here. And then the manual has some really good information about how to approach clients that might have comorbid issues. So like for comorbidity on page 84, it talks about how to approach clients that have like depressive symptoms with anxiety. Goes on to continue talking about like what to do with clients that have ADHD related symptoms, hyperactivity, obsessive compulsive patterns, panic attacks. Those are very common comorbid issues with anxiety disorders. And then you also have other things that can complicate treatment, like what about when they don't want to participate? How do we approach them? What about when they're very critical of themselves and their performance? So there's recommended strategies to help them with that as well in this manual. What if they refuse to go to school, like common things. So this also has here for the table of contents, it comes with some really great things, like you have a bank. The reason why we have a bank in a reward menu is because you want to emphasize to the child and the parents that participation is highly encouraged, and we want to reduce as much avoidance as possible. When young children come into counseling, especially if it's for the first time, they're probably really scared. They're probably really worried that, like, what is this going to be about? Am I in some kind of trouble? Is there something wrong with me? And this is just a really important time that we encourage engagement. We encourage participation, and we reward them for that. And we give them this kind of notion that, like, hey, like, it's fun to show up and I get to play games, I get to do cool things, and I get a reward. So you want to increase the reasons why they want to come into counseling. It's very, very important. And so this workbook has all kinds of great stuff, and you do come up with rewards that are tailored for the client. So you want to get to know the client as much as possible, where you want to know what they like to do for fun, where do they like to go, what are things they like to do, who they like to hang out with, and you want to encourage them receiving the reward for their hard work in coming to counseling and in trying to manage and cope with their symptoms. So you want to make this as much of an enjoyable experience as possible. And then you have situation cards, which I'll share with you right now, just kind of what you see. I'll go to page 74. So here's the bank, where it's kind of like a calendar where you can give them stickers and you can give them points for how they're doing. Session 4s are free because it's a parent session. Session 9 is also free because it's another parent session. But here's where in the bank, they tally up the points that they earn with you just for their participation. And it's really up to you and the parents to decide, like, what do each points mean? But I'll show you that. So here's a reward menu, kind of like what we saw in the Study Teen workbook. There's a reward menu for rewarding them for their participation and number of points or stickers that are required to earn a reward. So maybe a reward would be, I really like it when my mom makes spaghetti, and then so, okay, if you were able to, do your homework assignment during the week and you participated in session, then that's like worth 5 points, and that's enough for spaghetti, or something like that would be encouraged and rewarded right away. So we want to implement principles of operant conditioning here, okay? Because remember, when we want a desired behavior to increase, typically that's done through a reward where they perceive that this is beneficial to me. And then you've got these situation cards. These are things that you'll go over initially in the first and second session. So with situation cards, you want to talk about, you know, easy situations, easy anxiety provoking situations where, like, you know, it's something that's worth practicing, but I feel like I can manage it and I think I have the coping skills to deal with it. And this is going to be very helpful when you integrate how their thoughts, feelings, and actions all relate. But you want to steadily increase the anxiety in these situations for them. And you want to have them kind of tell you what these situations would be. Like maybe an easy situation right now would be like going to the store with their parent, where they do have to encounter people they don't know. They do have to be in a public place, but you know, they're with their parent, they can handle it. You want to get a situation like that, you know, written down so that you can go over all of what the curriculum will have them go over. My bodily signs and symptoms, my thoughts, and then, you know, how can I cope with that? Then you got medium situation cards. And this is just very helpful for role play activities. This is very helpful for just sort of like, you know, spontaneously talking about the thoughts that are behind their situations and how they would respond. And you can rate differences from one week to another. And then you got the more difficult ones, the more challenging ones. And I highly encourage parents too, to prepare their children for this. And oftentimes parents are very good at filling these out. But you want the child to do this with the parent and you collaboratively. But parents are very insightful because they know what their child's typically anxious about and can be helpful in, you know, writing down some of the more challenging things that they have going on. Then you have this fear ladder. These are all like supplemental worksheets at the end of the curriculum, but you include them a lot in session. The fear ladder is a hierarchy of these anxiety provoking situations, and you want to help them progress to where they're able now to implement the coping skills, where, you know, they're able to ladder up, where they're able to demonstrate that, you know, initially this was a very difficult situation for me, but now I'm a little bit more prepared for it. And, you know, I have now the coping skills the higher we go on the rung. You might initially, let's say somebody's afraid of spiders. You might initially say that we're gonna look at pictures of spiders, right? And then from there, you might look at a video. And then from there, you might actually bring a spider in. You know, I'm just kind of giving an example of something that kind of, you know, shows how we would go through this hierarchy, right? But typically with young children, they tend to be anxious oftentimes for social situations. A lot of children have social anxiety. They're afraid to go to school. Maybe they anticipate criticism. But let me ask some of you all, what do you suppose could be some of the common reasons why young children show up for counseling, specifically for dealing with anxiety? What might be reasons behind their anxiety, and what could they be coming in for? What are they scared about?
Change, like say transitioning from one type of school to another. Like, you know, my son deals with anxiety from moving from elementary, which has its own paradigm, to middle school, which is completely different stylistically in how they even approach education. So there's that.
That's an excellent example. Yes. You know, we all oftentimes get uncomfortable with change. And if a child comes in and it is a situation related to change, share your own personal experience too about like times when you've had to go through change, and, you know, normalize that feeling anxious is something that we all go through. And this is how I cope with that. So yeah, that's right. A lot of times that can be very anxiety provoking is change. And there's a lot of what ifs. There's a lot of things that they just feel unprepared for, right? And that's really the main thing behind anxiety, is we're unprepared for how we will deal with a situation that we, you know, are concerned about. We don't know how we're going to handle. And sometimes we then fall into these thoughts like worst case scenarios, right? Any other situations that come to mind when you think about things that common issues why children are anxious. 7 to
I
13. Oh, go ahead, April.
no, I was gonna say I have two. I was gonna say it's very normal for this age to have anxiety about fitting in. Developmentally, it's a very appropriate thing for that to happen, and also grades. Meeting parent expectations, stuff like that.
Wow. Yes. Very good example. So speaking on what you were saying about fitting in, we are relational beings, right? We want to just connect and we want to feel a sense of belonging. It's sort of like a basic human need, right? If you're thinking about like William Glasser, reality therapy, he talks about our 5 basic human needs, and one of them is love and belonging. And yeah, as for young kids, like we want to fit in, we want to relate, and it can be really scary when you see so much criticism around you, when you see kids being bullied or being made fun of, and you don't want to be a victim to that either. And playing video games online, and then you hear how certain things are said over the headset, and you're like, oh man, like I don't even know if I want to go to school. And so because kids are going to just be mean, so kids just kind of have that reputation. So yeah, like that's very, very tough. And then divorce and family conflict is also, yes, very, very tough, because then, I think with a lot of young children are very, very egocentric still developmentally, and they do tend to have a very strong self-focus, right? And they often put a lot of blame on themselves for things that go wrong, which really have nothing to do with them or isn't their fault at all. But they tend to sort of like feel like, did I do something wrong, or what's going to happen? And even if it's not related to them personalizing it, still, like, divorce and family conflict is so challenging and difficult, because a child has so much dependence on the security of a family system, and to have both parents there loving and supporting them is very important to them. And when they go through a divorce, it's very painful and scary. And they don't know if they'll see them again. And then, yes, all these other issues you all are talking about, puberty, gender identity questions and concerns, sexuality, that's very strongly related to their identity, right? That they're going through, especially in early adolescence, like, who am I, and how do I relate to people, and how do I feel about myself, and how do I feel about people, and what are people going to think of me, about the choices that I make, and who I spend time with, right? So yes, all of that is important issues that we need to be prepared for, that clients will present to us. So starting back now in the beginning, session 1, you want to orient the client to treatment, and what's great about this manual here is it's very clear about what the session goals are. So for session 1, the purpose is to get to know one another, explain basic information about treatment, begin to gather information about situations that make the child anxious and the child's reactions to signs and feelings of anxiety. So you definitely want to ask them, like, questions about that, but you first want to get to know them. You first want to build rapport. And the goal of the first session is to build rapport, orient them to the program, orient them to the workbook, encourage support for their participation. When you first meet them, make sure that, they're very comfortable. Let them know, like, hey, do you need any snacks? Do you want a drink? Do you need to use the restroom? You want to make them very comfortable, use a relaxing tone of voice, give them a high five, to encourage participation. And you do want to orient them, like we said earlier, to treatment, and also the show that I can tasks, which are what we call homework, show that I can, or stick tasks. And then you also will engage in a fun activity in this first session. So here you introduce the workbook, and it says, hi, my name is Coping Cat. So there's kind of like a character that is present throughout the workbook for them, and it's Coping Cat. And it's a cat that shares their story too, about how they had anxiety and how they tend to behave, what their body symptoms are, what their thoughts are throughout the workbook. The Coping Cat shares this. Along with your therapist, we'll be working together for the next several weeks. Each time we meet, we'll be doing some tasks together. Now, this book may look like a lot to finish, but don't be alarmed. You won't be graded or tested in any of these tasks. Relax. We're going to try to have a good time while working together. Before we get started, I want to introduce myself. I think it's easier to work with someone when you know a little about them. Now, I want to stop right there and just say that you're strongly encouraged to introduce yourself and share a little bit about yourself too, and share what you like to do for fun. Here, you spend a lot of time asking them too, like about like what they like to do for fun, but I'll continue reading and I'll explain more. So Coping Cat was born in 1988. Coping Cat has 2 sisters and 3 brothers. When I was only 6 weeks old, I was adopted by a nice family. Boy, was I scared when I first went to my new home. I even hid under the couch for a while, and cats do that, right? I even hid under the couch for a while. It seemed like I was afraid of everything. I guess that's how I got the name Scaredy Cat. I still get scared sometimes, but I've learned how to handle it. Now you know a little about me. Let's find out about each other. So you might ask them, do you have a pet at home? Do you have a cat at home? Do you have a dog? Do you have a bird? Like, you know, ask them about their pets and ask them too if they recognize any similar feelings in their pets. And young children will tend to warm up to you that way and talk about their pets. They love their pets. And so they'll talk about that. And then you jump into what we call a personal facts game. Remember, the whole point of the session is to build rapport, have fun, orient in the treatment, normalize anxiety, right? So what is your therapist's first name? This is where you say, you know, hi, my name is Jimmy. And then you just share a little bit more about yourself. You share more about personal information. One thing I want to mention that this manual emphasizes, which is so good, that I want you all to understand too, is that treatment manuals should be guided templates, not rigid code books. What's really cool about this manual is that, again, it goes over recommended tasks, but it also has portions here where under the specific tasks for each session, it'll have what's called flex next to it, which means be flexible here. When you're going to get to know each other, be flexible. When you're going to, you know, help them recognize bodily signs of anxiety, be flexible. When you're going to teach them relaxation exercises, be flexible. When you're going to teach them cognitive coping strategies, be flexible. So it really allows you to integrate things that you find helpful that are not in the workbook, as long as you're kind of following this model, you know. And then there's what's called tips from the trenches. This manual has recommended tips, easy to read, highlighted in bold here, for recommended strategies and tips from people who have done this before, who have used this workbook. So it's really, really cool. So personal facts, you know, you get to know them a little bit, get to know what they like to do for fun. What's their favorite TV show? Do they have a favorite superhero? And that's a big thing today, right? Superheroes. And talk about too, like, how do superheroes cope when they're under a lot of stress? How do they handle anxiety? So those are all really helpful. And then, you know, make up 3 of your own questions to see if you can find out the answers. So maybe they have questions that they're coming to counseling with. Ask them too, like, have you ever been in counseling before? What was that like for you? Was it helpful? But they may have questions about anxiety, like, will I ever get over this anxiety? And maybe like, why does my face get so red? Or why aren't I able to speak? Why do I forget how to do things? You know, stuff like that. Also, if you have a room where you have a lot of toys and games, have them like check out your office, have them check out the toys and the games that they like, and have them also, you know, plan what they can do with you at the end of the session. Because what you want to do is, if you have games and toys, plan to do that with them for like the last 5 minutes. Now you want to kind of set it up to where this is going to be like a reward for their engagement. Like, let them know, yes, like, do you like that toy? Like, do you like that Uno card game? That's good. And well, then, you know, we're going to make time to play it. I'm going to make sure that we're going to make time to play it. And you're kind of making a commitment to them. Like, you're making a commitment to them that, you know, you're going to follow through, knowing that they like something and they want to do something. You're going to follow through on that activity. And so you play. So if someone's like, what do you mean you just play games with your client? Well, you don't play games the whole time. You play games strategically meant for their engagement and participation, okay? So introduction to feelings and thoughts. I like to introduce a cognitive model here because I think it just is a simple way for them to know like what this means. So it says here, throughout this workbook, we'll be talking about your feelings in different situations. Sometimes we'll talk about situations that you enjoy, and at other times we'll talk about situations that make you scared and nervous. Let's start off today with a situation that was fun. I want you to think of a time when you really enjoyed yourself. Take a minute to think. Got one? Great. So they're gonna talk about a situation where they enjoyed themselves. You might want to model this for them too and talk about a time where you really enjoyed yourself, but what was the situation? What were your thoughts? What were your feelings? You know, I often share the example like, you know, I really enjoyed myself when I was in my backyard and I was playing catch with my dog. And I was thinking, this is so much fun. I'm glad that we're getting to spend time together. And then my feelings were happy and excited and, you know, joyful. Or other similar situations, have them share a time where they really enjoyed themselves. So it's helping them understand this. It's helping them understand how our thoughts, feelings, and actions are all integrated, are all connected, right? And whenever I feel a certain way, there tends to be similar actions and behaviors related to that feeling, and there are thoughts that are in sync or related to the way I feel. And so that's just another very important thing that you want to show them. And visual aids, by the way, is very important. I highly recommend you get a dry erase board and have it with you if you're going to see clients in your office. If you're going to be the kind of counselor that travels, that does, you know, like community-based counseling where you go to their homes or you go to the school, carry around with you dry erase board markers. You can even carry portable dry erase boards or just papers and markers, because just visual representation of these things is very helpful. And then bring copies of, you know, these workbooks with you, bring copies of games, fun activities. You do spend a lot of time drawing in this curriculum and you spend a lot of time playing games. So that's helpful for them. A lot of kids play video games, and Nintendo Switch is a portable game system. And so that's also, you know, if you want to invest in that, it's helpful to do that. But some parents are concerned about them playing video games too much, and you don't want to, you know, make that an issue. So be aware of what parents are comfortable with too. Next, describe a situation that happens on a typical day. Think of a time that was just okay. Earlier we were talking about really fun, enjoyable stuff. Now we're going to just talk about normal day. Like my situation that I model all the time is, you know, I got up, I ate breakfast, and I drove to work, right? And so my thought was like, will I get to work on time? You know, maybe I'm a little anxious here in this example, because feelings of anxiety happen in normal everyday situations. So here we're trying to normalize feelings of anxiety and gradually introduce the concept that sometimes we deal with situations that are scary to us. And so what do I think? Well, I worry that maybe I'll be late, or I have feelings like, you know, like I notice with my body that like my heart's beating a little faster, my adrenaline's kicking in, right? My muscles tense up. So then you have them explain a situation. And oftentimes kids share the same thing. They share like, well, am I going to be on time to go to school? Did I get all my homework in? Did I forget it? You know, did I forget anything? Will so-and-so talk to me today? So that's helpful. And then you teach them about the show that I can tasks. These are what we call homework, but they're called show that I can tasks or stick tasks. We're going to end each session with an assignment we call stick task. A stick task is something that you can do to show that I can. You will learn lots of new things working with your therapist and doing this workbook. We want you to take what you learn with you and use those new skills in other situations. That's why we come up with the idea of stick tasks. They're your opportunity to practice what you've learned. Then at the beginning of each session, you can show your therapist what you have accomplished. It's your choice. It's your chance to boast. So it's your chance to show how good you're doing. And so it says here, every time you do a stick task, you will receive 2 points or stickers that you can use to earn a reward. What kinds of rewards would you like to be able to earn? So on page 73, which I showed you earlier, was that, right? You'll see a reward menu. This is where you can list each reward with the number of points that it costs. After sessions 4, 8, 12, and 16, you could spend your points on some of the rewards you listed in the reward menu. So the reward menu is this, and there are certain designated points in time after so many sessions where they can spend on the big points that they want to earn. Make sure that these are realistic and reasonable, and that the parents, can, if it's things that cost money, make sure it's things that the parents can afford. Mostly what can be very helpful is just spending time, going to their favorite place, like a park, those kind of things that are inexpensive. Okay. So they're given a homework task. They're given a show that I can task. Write an example of another time you felt really great. You weren't upset or worried. Remember to describe the situation you were in, what you were thinking, and how you were feeling. Do this task on your own for the next time. When you and your therapist discuss it next time, you can earn 2 points. So be sure to remember. So that's what they do. They just have to write down a time they felt really great. And here's what it is. This is their show that I can task. This is their homework. It's already kind of laid out for them. So here's where they describe a time where they felt really great. And they're going to get into the habit now, in the practice with you of writing and going over this. So here's Coping Cat having a good time when he was fishing. Now, you want to also have them remember, what does stick mean? Show that I can, right? So this is very, very helpful for them to just get in the practice of doing. Okay, and then in session 2, now we're going to get more into recognizing our feelings. And that even includes, like, what does my body do? But that's more in session 3. So what you want to begin doing is, again, review homework, review the show that I can task. Did they journal? And if they didn't do their homework assignment, don't make them anxious about it. Don't make it punitive. Of course, like you want them to understand that, hey, I understand things come up. Let's go over it together. Let's try to remember a time you did something enjoyable this week. You don't want them feeling like, oh, I didn't do something right. Because you want to encourage engagement and participation. You want to reduce avoidance, reduce fear. So how did you do on the stick task that from last time we met? And then you discuss it and you record it. And then in the activities menu, what feelings do people have? This is where we're going to talk about different feelings people have, and not just anxious feelings or fear. We're going to talk about other feelings people have too. This week, we'll have some fun learning about the many different feelings that people can have and how to recognize these feelings in ourselves and others. Let's start by listing some different feelings you can think of on the lines below. So, this is where a child, and I'm thinking of a young child now, their vocabulary may be very limited. So you want to spend some time modeling for them things like words that represent emotions. Like they may just know happy, sad, scared, and mad. And that's fine. And if that's all they know, you can list the different feelings people have, but also let them know about some other words. Like another word for scared is anxious, or worried, or concerned. Another word for happy is excited, or joyful, or just outstanding, feeling great. For angry or mad, you got mad, you got angry, you got frustrated, and then there's different degrees of which some of these words mean for the level of feeling. And then you ask them, like, how can you recognize when someone is feeling these different emotions? Can you recognize the bodily signs and symptoms people do? You want to also kind of orient them to the importance of them learning how to be like a detective here. Like Coping Cat kind of talks to them too, like we're detectives, and we're trying to get the clues on how does my body react in certain ways. Like, how can I tell when someone's angry? How can I tell whenever a family member is angry? And this is where I might ask them, like, what's it like whenever you're feeling angry? Or what's it like whenever your mom's angry? Or whenever your dad or your brother or sister? What are some common ways you can tell? What are some bodily signs and cues there? How about when they're feeling sad, when they're feeling happy, when they're feeling, when someone is surprised? And then you want to go back and maybe visit some situations that might be behind that as well. But to emphasize too that our body does certain things based off these situations, based off the feelings we have. Just to recognize how they're all related. Now that you are thinking about feelings, think about this. Besides saying what you feel, how else do you know what someone is feeling? Here's a question. How do you know when someone is angry? Can you think of 2 ways? Write your answer in the spaces below. So then you'll have them do this with you. Then they just do matching the face with the feeling. So now they're being able to now discern what someone could be feeling by their expression, by their bodily reaction and response, right? So what do you suppose someone might say for these first 3? What about this first one? What's a common feeling somebody might have with this expression here? What do you all think? Maybe like proud, right? The second one is kind of hard to discern sometimes, but maybe like angry or frustrated or just disappointed maybe. This person looks exhausted for this third one. So you kind of go over these feeling faces with them and help them understand that. Yes, and you can add the anger iceberg to help them recognize some of the underlying deeper situations that are behind the feelings that we have. And then you do a feeling role play. This is where you kind of play like charades with them. So with charades, you act out situations based off the way they feel. Here's where you would have them draw an expression to a situation. So your best friend comes running up to you on the playground. Your friend says, "Let's go play." What feeling would you have? So I would be feeling maybe excited. I'd be happy, looking forward to want to play. And then I would draw us doing that, right? So that's really good engagement. You can spend a lot of time with them drawing the way they feel and situations behind their feelings. This week, you and your class did a pretty good job on your assignments and were very well behaved. And the teacher decided that you could all go to the school trip to the zoo. But on the day of the trip, it was raining. So the trip to the zoo is canceled. What feeling do you have? Well, now I'm feeling a little disappointed. I'm feeling sad because I was really looking forward to going. So then you would draw that feeling. So you spend some time doing that with them and you talk through it with them. Like you have them, spend time like to know more about them. Were there other times you were disappointed? Were there other times that you were unhappy or worried or anxious about stuff? And then you're kind of now like preparing for them to recognize more signs and symptoms of different feelings. So here's a picture of people going on a camping trip. And these expressions are pretty, they're not much expressions really, like it's hard to really discern what's going on. So it might be more of a projection activity with them now where they're gonna tell you like what mom might be thinking, the dad might be thinking, the brother and the sister. But like I would be thinking this is fun, I can't wait to go. Maybe the dad is thinking like, do I have enough gas to make it to the next stop? Maybe the mom is making sure that her children ate something, and maybe, I don't know, different things go in your mind, right? So you have them kind of like, write down what could they be thinking, and it'll reveal a lot to you. It'll reveal a lot about also if this was their family, what might it be like if they're on a trip? Have they ever been on a trip before? And what is it like when they're on a trip? How does mom feel? How does dad feel? How does brother feel? Sister feel? What do they tend to think about? Do they ever worry about anything? Same here. You know, and here you got more of a situation now where like you've got maybe something very relatable to them where there's a group of kids playing, and it seems like to me that this one person might be feeling left out. But you want them to kind of like, you know, share with you what they think is going on here. So here you're helping them recognize what could be the way they feel, what could be the way their body's reacting, and what are they thinking. But the real emphasis here is getting them to discern what's going on. Can I recognize these different feelings in people and myself? And then they get to know a little bit more about you. My therapist feels worried when. Ask your therapist about a time he or she felt worried or scared. Find out how your therapist handled the situation. So you want to kind of prepare yourself with a relatable situation for them. And then let's look at the situation cards or the fear ladder. On page 74 to 76, you'll find some situation cards. They're labeled easy, medium, and challenging. Whenever you think of a situation in which you feel only a little bit nervous or tense, write it on one of the easy cards. If it would be really scary, write it in one of the challenging cards. When you think of a situation in which you feel scared or worried, but it's not too easy or not too scary, it's a medium card, right? And then they can write it in the fear ladder as well, just so that it can be something that they can gradually work themselves up towards with the coping skills that they'll gain. So that's the idea of session 2. You give them a stick task for homework. On the next page, write 2 situations that happened to you. One situation should be a time when you felt really scared or worried. The other situation should be a time where you felt relaxed. So homework 1 had a time when they felt excited. Homework 2 is now a time when they felt worried and a time they felt relaxed, because you want to help them see how you can go from one feeling to another. You want to help emphasize too how it's very different to feel anxious from feeling relaxed. And you want to get them later to practice relaxation to shift that feeling of anxiety from anxious to relaxed. So they write 2 situations, one of them being anxious, one being relaxed. Be sure to include the details about what happened. Write down how they knew what they were feeling and the thoughts or feelings that they had. So here's what it was. I was nervous or scared or worried when, and I felt relaxed when. You can even do this in session with them and then have another worksheet like this to take home for them to do in the middle of the week. But it's really important that they come to just remember their role as a detective now. They're also going to kind of recognize clues to these things. Watch someone else this week. It can be someone in your family or a friend or a TV character or even a superhero. How can you tell when this person is feeling if they don't tell you? Name the person, name the situation, what were they feeling? You can even prepare like a little video. If they didn't do this, you can prepare like a video of like a superhero doing something where they saved someone or where they had to deal with something anxiety provoking, and they can kind of write all this down with you just to recognize all this stuff. How does my body react now? Session 3. Session 3 is all about getting to know their body's physiological responses. What is my body doing? What is my heartbeat like? Is it beating fast? Is it beating slow? What is my breathing like? Am I breathing fast? Am I breathing slow? What is my muscle tense like? Am I tense? Am I relaxed? So it's really good to know this, because then they can also learn how they can gain control over their body, especially when it comes to understanding how we can gain control over the way we breathe. You're going to practice deep breathing, all the relaxation exercises that you all know, throw it in here in this session. Get them to practice, get them to role play with you. So that's really helpful. Something I didn't also emphasize earlier that you do in session 2 is you introduce them to a thermometer, which is like a feelings thermometer. It's also called the SUD scale, which is the subjective units of distress scale. And that's where they can use that in session whenever they're going to be maybe practicing with you, role playing some anxiety provoking situations. they can always refer to the SUD scale on a scale of like 1 to 8 is what it gives here. I usually say 1 to 10. So on a scale of 1 to 10, 10 being the most anxious you've ever felt, and a 1 being the most relaxed, where are you at on that thermometer, on that feeling thermometer? And whenever they're even just disclosing something to you that's anxiety provoking, ask them like, how anxious do you feel right now on a scale of 1 to 10, 10 being the most anxious, you know, and that'll give you a good baseline measure. And if there's a certain number that they don't want to go past, have them share that with you. Like, okay, like if it's past a 7, like I feel like a 6 right now and I'm about to get to a 7. I don't want to go past that. Then you can practice like relaxation strategies, just so that they can orient you to how they feel, and you want them to know that it's a safe place for them. They don't have to go beyond what they're capable of in session. Any questions so far on anything that I'm going over before I jump into session 3? Okay, we're gonna have some time later where we're gonna practice this in a role play. We'll do that once I introduce to you the FEAR model, the FEAR acronym. Okay, so here's where it's all about how we come to know how our body reacts. Today we're going to talk about the ways our body might react when we feel nervous. For example, as a cat, I show that I'm scared when my fur stands up. When I'm frightened, I feel like a scaredy cat. Sometimes being afraid is okay. There are times when everyone's a little bit afraid, and here's when you want to normalize that feeling, because what I know from my personal experience is that being afraid has helped prepare me for things. It's helped me be sharp. It's helped me stay alert so I can stay alive, so I can be safe. So it's a mechanism built within us that allows us to keep ourselves safe and protect ourselves. But we want to gain control of that, because that's a very powerful tool, and sometimes we can respond beyond what's necessary. So we want to go from scaredy cat to coping cat. Sometimes being afraid is okay. Everyone can get a little bit scared, but there are other times when we don't have to be afraid, when I keep my cool. This is, just something you can talk about with them. What's it like keeping your cool? Do you know how to keep your cool? I feel like I can cope with whatever comes my way. I'm a coping cat. Do you know anyone who keeps their cool? Who are some people who who can keep their cool? And you talk to them about maybe family members, friends, superheroes again, TV characters. The Fonz, they don't know who the Fonz is probably, but like on happy days, he would always keep his cool. So like just some examples that you can think of. Activities menu. How do my family members show that they're scared? And here, if you are talking with parents, you can have them share some examples, or have them encourage these conversations with their parents to kind of normalize that for them. And they draw a picture. How do our bodies react when we're anxious? Now, I like this. This is helpful because here we can get them to visually see what our body's doing. So what is my heart doing? What does my stomach feel like? What about my head? What about my arms, my chest, all the different muscle groups? So here, they'll explain that to you. Let's answer some questions about how our body reacts. So it says here, Marina was very hungry. She ate tuna fish that had been in the fridge for several weeks. A few hours later, her stomach felt upset. Why do you think her stomach hurts? Was it because someone punched her? Was it because she worried about a test? Or was it because she ate spoiled tuna fish? So they'll know from the story, from paying attention, that it was because she ate spoiled tuna fish. Here, you can kind of talk about how our stomach, sometimes when we're feeling anxious, can feel that way as if we ate something bad. And then here, Terry is about to give a book report in front of the class. He notices that he feels sweaty. Why might we feel that way? Well, he ran to school earlier that morning. It's hot. It's a hot day outside. No, he's nervous that he's about to speak in front of the class. And then what you could do is you can model a role play. So that's highly encouraged in this. You can role play a situation where maybe he has to give a speech. Maybe he has to like do a like I do like a common thing with children where they have to pretend that they're going to meet someone new for the first time and they have to introduce themselves to someone, which is a little anxiety provoking, right? So you'll role play it, you model it, you model you doing this, and then you have them do it with you together. And then they then learn one of the first steps in coping with anxiety. So along the way now, you're going to have an acronym that they're going to remember. So they already remember the STICK acronym. They already remember the show that I can. That's all for homework. That's all about them, going through this curriculum with you. That's all about them like journaling, reflecting, giving examples. That's the show that I can. But now the FEAR acronym is another acronym that they'll do all the time. And the F stands for, are you feeling anxious or feeling frightened, right? E is, are you expecting bad things to happen? A is attitudes and actions that can help. And then R would be results and rewards. But we're going to go over this slowly in the curriculum. So the first thing we do is just figure out what F means. Are you feeling frightened? This kind of goes back to already understanding. We already went over, how does my body react? We already went over, what am I feeling? So then now I'm going to use this acronym. Am I feeling frightened? Recognize that your body feels tense and that you're worried, which is the first step in learning how to cope with situations that make you anxious. To help myself remember the step, I call it F, feeling frightened. Let's imagine that you're nervous. What's the first clue that you have that you're feeling anxious? So now you're going to have them visualize with you. You do a lot of visualization related activities now, and you're going to have them think of an anxiety provoking situation. And then they're going to talk to you through it. How do they know that they're feeling anxious? They can look back at session 2 because it's a lot of a review. But in session 3, now we're just going a little deeper here. For the show that I can task, they're going to draw their own rating scale to rate how their body feels in different situations. During one day and evening, pay attention to how your body reacts when you feel different ways. See if you can tell how anxious you become when you feel different ways. See if you can tell how anxious you become by how strong your feelings inside your body were. Then use your rating scale to record how you felt about the situation. So here's a rating scale, which would be like that feelings thermometer we were talking about. They can make their own scale with you, and how they would feel in different situations. Maybe they can time it out right. Like on a scale of 1 to 10, a 2 would be maybe getting up in the morning, getting ready for school. A 4 would be like having to walk into school, and then a 10 would be like having to give a speech or having to, talk to someone. So here it's all about exploring and explaining that and rating this situation for them. Write down 2 times this week you felt scared or worried and give them a rating with your ratings scale. I was scared, I was nervous, scared, or worried when, and then they rate it, right? Okay, session 4 is very important. This is where they're going to be rating their, I'm sorry, let me back up and let me finish something with session 3. From the tips from the manual, tips from the trenches, there's some really good recommendations here. Remember always to review the past concepts. Remember that you as a therapist can disclose anxious experiences on your own at any time. Remember that you want them to engage in the body drawing activity. You want them to play a guessing game with you where you and the child can play a guessing game to make learning about somatic responses fun. So that's kind of where you're doing like a role play and you can do like a feeling charade. The therapist and child can take turns guessing what emotions the other's feeling. And then you can use what's called the fire alarm analogy to help explain the experience of somatic response. That's a really good analogy too, because talking about anxiety, why we have anxiety, what's it doing, why does our body respond a certain way? It's kind of like an alarm going off, right? Our body acts like an alarm, and it tells us something's or I'm not prepared for something, something bad might happen. And how there's different levels of an alarm. There's also different levels with what our body does. But now with the parent meeting, let me ask you all, why do you suppose it's important to talk to parents now about the progress that their child's making, but also like what role do you think parents could have on anxiety and how their child responds to the treatment for anxiety? What do we know about the etiology of anxiety? Oftentimes anxiety, yes, is often from like a traumatic experience, right? But where else can anxiety come from?
It can be learned behavior.
Absolutely, it can be learned behavior. And where do they learn that from, right? They learn that from oftentimes their parents. And so parents oftentimes underestimate or they don't recognize just how they communicate their anxiety to their children. A lot of times children tend to be anxious for the same reasons their parents are anxious for. So when you meet the parents, the purpose here is to, provide additional information about treatment, provide parents an opportunity to discuss their concerns, like what are they concerned about still about their child, learn about the situations in which the child becomes anxious. Maybe they don't know, maybe the child reveals things to you, but also offer specific ways that parents can be involved in the program. And I often ask parents, what are the things you are anxious about? What are the things you worry about? And how much of that does your child know? And it becomes very insightful for them. They realize, wow, like, maybe there's a lot of things that I kind of spill over onto my child. Like maybe there are things that I am modeling. I'm modeling anxious behavior for them, especially when it comes to meeting new people, maybe because I tend to be very guarded. I tend to think that people have bad intentions. And so I always tell them, don't talk to strangers, and I notice that my child really does have a hard time talking to people, like those kinds of things. And it's normal, like normalize that, talk about that. So they really are heavily influenced by their parents. So it's helpful to talk about that. And the child has a week off. So it's just you talking to the parents. You can have the child there, but it's better sometimes just to see if they can just talk with you without the child, because you get more insight from the parent in many ways. So they don't have homework this week. I'd say, they can do the same thing. Just keep an eye out for your body signs and symptoms, times when you're feeling anxious. And then session 5 is learning all about relaxing now. Robot ragdoll. Here's where they're going to talk about how our bodies feel when they're relaxed and how they can feel when they're tense. Think of a time when you felt happy and relaxed. Imagine that you're in the situation. How does your body feel? Now make a fist. Does it feel different than how your body felt when you were relaxed? The thing about that is whenever we're stressed, our body does tense up naturally, right? But when you can tighten your own body and you make it tense, now you're back in control of your body. And just like you can tighten your body and stress your body out by tightening your muscles, you can also relax your muscles after that. And that kind of reminds them, hey, I'm in control of my body. So now make a fist. Does it feel different than how your body felt when you were relaxed? When I get tense, my body feels stiff like I'm a robot. Try to be stiff like a robot. So now we act like robots in session. We're having fun. We're having a good time. You want to build rapport. So be silly. My favorite robot is C-3PO from Star Wars. Think about your favorite robot. I always say Johnny 5, but they don't know what I'm talking about. So, but Star Wars is big, right? Star Wars is popular. So I bet that you can walk like a robot walks. Just tighten your muscles and give it a try. Next, I'd like you to relax your muscles. Be floppy, like a rag doll. Pretend that you're Raggedy Ann or Raggedy Andy. I had a client who was scared of Raggedy Ann dolls. So that was not a good example, but just kind of know that, yeah, that's very rare. So have them act like a doll, that, like a doll that's very flimsy, or like spaghetti, or like cooked spaghetti, very flimsy and raggedy. That's what our body's like when we're relaxed. Like whenever we want to come home from school after a long day, or come home from work, we just want to flop on the couch and relax, like have them understand that. Okay. Melting, yeah, like they're melting, or that they're acting like slime. So that's good. And show them things, like prepare something that's visual for them to see what it would look like to relax, but do it for them, model it for them. That's very helpful. And when they're like for like at home, when they're anxious, do the robot rag doll. That can be like a coping skill. Do the robot rag doll at home whenever you're feeling anxious. So they stiffen and then they relax. Sometimes we can also notice that when other people feel tense by the way their body works. Look at these pictures. Can you rate how relaxed the cat feels? So here we got a different rating. How would you rate this cat? Well, this cat is laying down. This cat is probably very relaxed. This cat here is probably the most tense cat of all these cats, right? So this would be like all the way, like a 4. So they're getting the practice of rating. This cat looks a little anxious, pretty nervous, maybe a 2 or a 3. This cat's definitely like a 3, right? On that scale. Don't bother me, right? The muscles of the body. So here they're learning about the muscles of the body again, and how different muscle groups might, it's useful to know different muscle groups, because sometimes we carry a lot of stress in our muscles, and our muscles tense up at different points in time. Like look at this cat, the muscles of its back are all arched up, right? Very anxious. So you learn about the back, the biceps, the calves, the chest, the face, the feet, the forearms, the hands, the thighs, the neck, the rear end, the shoulders, the stomach, and the triceps. So all the different muscle groups in our body. And you can then practice some progressive muscle relaxation. Don't have them tense their muscles too tight, like don't go 100%. You don't want them to hurt themselves. Sometimes little kids get real excited when they want to do this with you. So just have them go like 50%, 70%, like not all the way, but to tighten it enough where they know that they're tightening. And then they practice relaxing. So they learn to relax. This curriculum also talks about recording. I don't record clients. We don't have permission. But the curriculum, maybe the parents might want to record their child whenever they're anxious, so that the child can see for themselves what they look like when they're feeling worried. Are they tensing their muscles up when they're anxious? And then what do they look like when they're relaxed? So for the show that I can task, try to relax at home, then record your experience with the relaxation in your notebook. This relaxation exercise will become easier for you the more you practice. So try to set it aside sometime every day. Write down the day and time, then describe how you became relaxed, and describe 2 experiences in which you felt nervous or scared. Record the thoughts that you've had and how your body felt. And so here is the show that I can task. Practice your relaxation every day at home. So they practice the visualization, they practice the progressive muscle relaxation, they practice deep breathing. This is also what's emphasized in this session. So the tasks for this session, again, just kind of a review. Acknowledge the parent session, review the show that I can homework from before, introduce the idea that many somatic feelings associated with anxiety involve muscle tension, introduce the idea that relaxation and practice relaxation techniques. How do I relax? This could be imagining feeling tense and then relaxing ourselves for practice in session. You also might compare feeling tense to feeling relaxed, and what's different about my body, what's different about the way I think, what's different about the situations. Go over deep breathing. Okay, a lot of this stuff might sound real simple. No teenager would really just buy into this stuff. Well, if you explain it, a certain way, they'll understand that this is very important stuff. A lot of times what I've learned is that simple concepts go a long way and are very powerful. So deep breathing is very, very powerful. What do we do when we're tense? We go, we take a deep breath, right? We kind of search for a way we can relax our body and calm our body down. However, with deep breathing, I want to say that if you take a deep breath through your chest, like that could be a very stressful breath, right? If we're gonna like take a breath like where we're like gonna fight someone, that's probably how it would go. And that's not the kind of deep breath we want to take, right? We don't want to take a deep breath like we're gonna like be in some kind of altercation or something, right? So I like to explain to them how if you watch like a baby breathe, and you know, if they have a little sibling or something, like a little baby in the house, it's helpful. But if you watch a baby breathes through their abdomen, through the lower lobes of their lungs when they're sleeping, right? They're just taking a big deep breath in and a big deep breath out, but their tummy is going up and down, right? So if you practice with them deep breathing like that, just taking a deep breath through your nose, filling their tummy up, and then hold it gently, and then take a deep breath out. Notice that their abdomen, is kind of going back in. So you slowly introduce deep breathing. There are different ways to do that. Some people introduce a deep breathing where like you have your hand up and you climb your hand. You take a deep breath in, breath out, breath in, breath out. So I model that for them too. Some people have like a pencil on their desk and they take a deep breath in and then take a deep breath out just to gently like roll the pencil. That might be a little too much though. So you want to have them understand like there's too much of breathing in and out, and then there's a very appropriate level of breathing in and out, and that might be something that whatever they're comfortable with, honestly. But you want them to practice that and to help them understand that whenever we are relaxed, we have a certain way we breathe. Whenever we're tense, we have a certain way we breathe. And what we want to do is induce. We want to promote this relaxation response in us. So when we take slow, deep breaths through our abdomen, through our nose, gently breathe out, then we become more and more relaxed. And then our muscles loosen up, our heartbeat starts to slow down, our body is now in more of a state of relaxation. And that allows us to have more relaxing thoughts, more calming thoughts. So that's why our triangle is important, because we have what's called reciprocal inhibition. Like our thoughts, feelings, actions are all related. You cannot have anxious thinking and a relaxed body. It just doesn't go well. That's impossible. So you want to emphasize how it's all connected holistically. But breathing is something that they're in control of. It's much harder to be in control of your heartbeat. It's much harder to be in control of, your circulation of your blood. But you can control your breathing and you can control your muscles. Okay. Give them as many relaxation resources as you can. So other tips here for session 5. Gently point out that the child that the muscle tightness that he or she may have noticed. Show them that relaxation gets easier with practice. Do the exercises along with them. Have different relaxation activities, scripts like guided imagery, meditation scripts, visualization scripts. Even getting like a drink of cold water, like that can help your body relax. Definitely. When kids are anxious in school, I've done this with a lot of high schoolers where they're really anxious during passing period time. That's very anxiety provoking because they worry about like being in the hallways, it gets real loud, all these kids are talking mess. Have them carry around like those thermoses with those Yeti cups with like ice and water. And they could just fill up, the ice can last all day in those cups. And then have them carry with them around. They sip on the water right before passing period, just so they can show that they can relax themselves during these anxiety provoking situations. Just strategies like that can go a long way. Okay, now we're going to go into session 6. And then we're going to go into a break. Then we're going to role play. So for session 6, it's all about what am I thinking? In this session, we're going to talk about the kinds of thoughts that people have in different situations. For example, if I want a catnip mouse at a raffle drawing, I would probably think I'm so excited. I can't wait to play with it. These thoughts are talking to myself, so that sometimes I call them self-talks. Now we want them to be able to recognize what's going on in my head. What am I usually thinking about? So here, what's in the bubble thought? This is a cartoon drawing of the Lincoln Memorial, a statue to memorialize one of the great presidents of the United States. We call the balloon over his head a thought bubble. It's where the cartoon character's thoughts go. This thought bubble is empty. What might he be thinking? Take a minute to think, then turn the page for what he might be thinking. So, a child might say, first of all, statues don't think. So then you say, okay, we're just going to pretend, that he's really sitting in this chair. What is he thinking? He might be thinking all the responsibility he has as president. But here he could be thinking, oh, I wish I had a recliner. I wish I had a more comfortable chair. He's thinking of a recliner. He wants to relax. That's what we want our clients to get into the practice of doing, thinking about relaxing. Now let's go to some other situations. For each cartoon, take a look at the situation and figure out what each person might be thinking. So I love this scenario because this happens to me a lot when I like to grill. I like to think here, okay, so when I show kids this situation, I first ask them, what could they be thinking? And the child might say, this is going to be delicious. I can't wait to eat it. I love having a barbecue. I love having my friends over, my family over. I'm usually thinking, am I going to burn the food? Am I going to control this fire? Am I safe? Like those kind of things. So I've had a lot of practice, so I'm better than what I'm sounding like. But I love barbecuing. I love grilling. But if I'm going to grill something new and I don't know how to grill, I'm a little anxious for it. And I look up on YouTube to see if I'm preparing it right. But otherwise, I'm kind of now like sharing my anxious thoughts, right? I'm sharing about what I'm anxious about here, and I'm modeling for them, how I can identify my own thinking, and I want them to identify their own thinking too. Here, what's going on in this situation? Maybe she heard a bear outside in the woods. Maybe she heard an animal, right? Or someone's, at the campsite. Sometimes it's not easy to tell what someone would have thought in a situation. In many situations, different people might have different thoughts. Let's consider the situation. A teacher just announced that the class would be going to the roller rink. Let's meet 2 of the students in the class. Chris has taken rollerblading lessons for a year and hopes someday to compete in contests, whereas Terry went rollerblading only once before, fell too many times to count, and went home with sore ankles. What do you think Chris and Terry would be thinking when they hear about the class trip? Do you think they would have similar thoughts or very different thoughts? So, Chris's thought might be like, I'm going to have a great time. I get to show off my skills. Terry might be like, I'm going to embarrass myself. Kids are going to make fun of me. So this is all about recognizing our thinking. Now look at the cartoon below. Think of a time. This time the character has 2 thought bubbles. Try to think of 2 very different thoughts that the person might have. Write one in each bubble. So they could be thinking, I'm going to pull off this stunt, this rotation, or maybe they're thinking I'm going to fall, or maybe they're thinking, I hope this ice is, cold enough, or else I might go through the ice. So have them understand how different thoughts equal different feelings and actions. So what is thought one and what is thought two? What are the feelings and actions for each one? The second step here, some types of thoughts can help us relax and some types of thoughts can make us anxious. So you look at this cartoon. What do you suppose each cat is thinking? This cat's thinking this dog is going to be aggressive and it's going to bark at me, maybe try to bite me. Whereas this cat is thinking this dog's going to be happy that I'm in the yard. He's going to want to play with me. So different possible alternatives, right? And it's important that we get good at evaluating our thinking, because what we don't want is to jump to conclusions and overthink stuff. And sometimes we can fall into thinking traps. So here you want to introduce to the E. E is, are you expecting bad things to happen? That's the second thing of the fear acronym. Are we expecting bad things to happen? So then they role play. When I was in a situation that makes me feel anxious, it helps me to notice what my thoughts are. For example, one day last spring, as I was chasing a squirrel, I followed it up a tree in my backyard. I didn't catch the squirrel. I followed it up the tree in my backyard. I didn't catch the squirrel. I never do, but I was high in the tree and suddenly felt very scared. I mean, that's actually happened to me where I was very high in a tree and I was scared I was going to fall. I couldn't get down. I didn't think I would be able to climb down without falling. My thoughts were that I would be stuck in the tree forever. When I noticed what I was thinking, I asked myself, is it likely that I won't be able to get down? I remember that I had climbed this tree several times before. Each time I had climbed the tree, I also had been able to climb down. You want to spend time too asking them, what are they, of course, anxious about? What are they thinking in their own scenarios that they face every day? And then for the show that I can task, they're going to write down 2 situations in which they felt scared or anxious. They're going to pay attention to the thoughts that they had and be sure to write them down. And so here's the show that I can task. I was nervous, scared, or worried when my body reacted. How did my body react? Feeling frightened. What did I do? Was my heart beating fast? Was I breathing fast? Was I expecting bad things to happen? What was I thinking? What was I feeling? But what was going through my mind? What I want you all to do after the break, I'm going to put you all into a breakout room, probably like groups of 2. And I'm going to have you all take turns being a counselor and being a client. And you're going to basically do the show that I can task in session with your partner. But I want the client to, portray the role of like a child, like maybe like 12, 13. But kind of go through these concepts like you don't know what these mean, like help me understand, like help guide me to understand, what I was feeling and what I could be thinking. Try to come up with a situation though that's relatable to you at that age. Okay. I was nervous, scared, or worried when, and you want to just, as the counselor, you want to introduce them to the fear acronym, especially emphasizing feeling frightened and am I expecting bad things to happen? Recognizing what my body is doing, recognizing my thoughts behind it. Okay. So we're going to take a 10-minute break. Let's come back at 11:45 and then we're going to jump into the role play. All right. So now we're going to continue. And what I want to mention also about this session is to discuss thinking traps too. That's a big part of what you also do in session 5. And you'll notice that the manual outlines some recommended terms to help them kind of know and recognize if they're falling into any of these thinking traps, right? It's similar to the ones that you've learned with other CBT approaches and curriculums, but one is walking with blinders, where they're only seeing the negative and overlooking the good in a situation. Like race horses wear blinders to see straight and not be distracted in a race. Well, sometimes we walk with blinders on where we only see the problem and we don't see solutions or, good things that could be related to the situation. Then there's the repetitor, where that's a thought where if it happened once, it's going to happen again that way, So if it happened once, it's going to always happen that way. That's the repetitor. So you just kind of want them to recognize how, like, we don't want to fall into these thinking traps. You have the catastrophizer, which is where they're just very pessimistic, like always thinking that the worst is going to happen. The avoider is a thought that where the thought says staying away from situations you think are scary without trying first, where they avoid situations because they just think it's going to go bad. And they don't even try. That's more behaviorally related. The mind reader or the fortune teller, this is where they basically like jump to conclusions about things, jump to conclusions about people, jump to conclusions about situations and outcomes. Same with fortune telling, like they already think that they know what's going to happen. Mind reading, they think they know what someone's thinking. That's very, very common with adolescents that have anxiety, especially like in school settings. The shoulds, I should have this, I should have that, and it's not going my way. I should always be perfect. I shouldn't make mistakes. And then there's a perfectionist where they set expectations too high. If I don't get an A, then I'm a failure. And then have them make coping cards. Coping cards would be just ways where they can kind of like reframe their thinking. So I'm sorry, this is session 6. I know it says session 5, but some recommended strategies here. The therapist can also ask the child to draw a picture of themselves in an anxious situation and then draw the thought bubbles of what they could be thinking. Provide examples of television shows in which the main character is the narrator. That would be like a way to do self-talk. The therapist checks with the child about whether he or she believes they have coping thoughts. Identify imaginary or real people whom they admire as good at coping, and what would they be thinking? Be careful not to fall into the trap of trying to convince the child that a scary event is not likely to happen. A good strategy is for the therapist and the child to reverse roles. Have the child act the part of the coach or detective and try to convince the therapist that a situation is unlikely to happen. It also might be helpful to discuss with the child what might be done if the worst possible fear ever does come true. And then the therapist and child can make a shorter or longer list of thinking traps, renaming them if necessary. Highlighting the ones typically used by someone the child knows or by the child themselves. When appropriate, the child can take the list home and post it on the refrigerator so that they're reminded of the potential thinking traps. Okay, what I want you to do for this role play exercise is kind of just go over this, show that I can task in session 6. Somebody be the client and you just discuss in session a time when you were anxious or worried. And I want you as a counselor to practice your active listening skills, your basic attending skills, reflections, try to understand that, and then help the client, coach them in the direction to understand, what was their body doing? Help them, come to focus on that. How can I tell that I was feeling frightened? What are common things going on? And then what was I thinking? I think we could do 3 groups of 3 with everyone we have here. I think we could do groups of 3 because we could have somebody be the role of a counselor, co-counsel, and one could be the client. And then am I expecting bad things to happen? I was thinking this, I was thinking that. And then what could the thought be instead? So help guide them for alternative ways of thinking and coping. And if you want to throw in there relaxation techniques they could do, if you want to throw in their cognitive coping skills, a way they can reframe their thinking, you could do that as well. If you want to take a picture of this, you can, just so you kind of know what we're going to be doing. But we'll put you into breakout rooms. Ashley, Melanie, are y'all able to do that?
Yes, I'm setting up breakout rooms right now. Are you ready for me to open them?
Yeah, awesome. Thank you. Yes. All right, looks like everybody's back. So I just want to hear from you all. What was it like doing your role play? I know it was probably challenging just kind of playing the role of a child again, but what was it like for you going through this process? And as a therapist, what was it like kind of coaching the child to acknowledge or recognize their bodily sensations and reactions and feelings, and then coaching them through recognizing their thoughts? Anyone want to share? Was it challenging in any way? Were any particular questions you asked helpful?
I thought it was challenging in the sense that you can't always say like coping mechanisms or things like that. You have to explain things in a different way with teenagers. And also just the tangential thinking that usually occurs with teenagers. It is more like coaching because you're trying to keep them on task.
Yeah, that's very true. They can easily get distracted. And so definitely. So having like a visual aid or a worksheet can kind of keep their focus on attention, especially if you're talking using like an analogy like of a superhero, right? What was the Hulk feeling when, Loki, crashed his ship in the planet or something, right? And then you can kind of just have them describe all those things. Anyone else want to share any other strategies or approaches that you took, just kind of going over this model for helping them recognize their feelings and then exploring their thinking?
No, the only thing I would add is just being mindful of the way we approach the language we use, similar to what Jolie was kind of talking about, is while we're striving to do things clinically appropriate and such, we may have all the terminology floating around in our head, and just being able to properly operationally define it in terms they can understand versus what we would textbook consider something.
Yes. Even when we're talking to adults, I mean, we need to be mindful of our language. That's a very good point. So a lot of these terms, it takes us a long time to even understand what they actually mean, and then we get comfortable using them. But for a child, these terms, like I'll have children say to me all the time, like, "What does that mean? What do you mean?" Like all the time, and I'm reminded, like, I need to just use language that's more developmentally appropriate. So just follow also what some of these worksheets ask, like, how does your body react? What does your body do? What goes on in your body? And what goes through your mind? What are you thinking? That's simple enough and can allow them to, share more. So let me share my screen again. So that's the show that I can task for session 6. And then you want them to practice relaxation. And then we're in session 7. And session 7 is all about, what should I do? What actions can I take now to alleviate my anxiety and my stress? So before I jump into that, what are some things that you all find helpful to help alleviate your stress and your anxiety when you're worried about something?
You mean for us as student therapists?
Just as human beings, what do you all find helpful that really helps calm you down and relax you during some anxiety-provoking situations? Like my client had shared how, filling up my water, my cup with ice, drinking it, during passing periods really helped calm me down. And like that, something like that was really cool to hear.
I like to watch TV. I like to watch TV.
Okay.
Or listen to music, Hispanic music.
Cool. Music, yes, music is very helpful. Deep breathing, meditation, playing with your dog.
Or sometimes I play with my grandchildren.
There you go, yes.
Outside, yeah.
So a lot of redirection too can be helpful. Getting our body doing something different, getting our mind to do something different. So it says here for our activities menu now, let's learn the third step. What we've learned in the last session is how to recognize our self-talk. That is the second step in our plan for coping with anxiety. Remember, the first one is F for, are you feeling anxious? E is expecting bad things to happen. And now A is attitudes and actions that can help. The more you practice noticing your self-talk, the more you'll know what you're expecting. Today, we'll learn a third step in the plan I use to help myself cope with worry. So far, you've learned how to recognize when you're feeling anxious and how to recognize your self-talk. Now let's talk about what you can do when you feel scared or nervous. How can we use what we've learned so far to be less scared, more relaxed, have a good time? That's attitudes and actions that can help. So whenever there's an idea about an attitude or an action that can help, remember, attitude is also like a thought, and an action is what they're doing, right? So attitudes and actions, thoughts and behaviors that can help. They'll write it on that page, on page 80, which I think is down here. The fear ladder, this is a feelings barometer. I forgot to show you all this, where they can kind of share how they feel that day. But then here's the fear model. This is where you want to write down, you want to show them this to take with them and put on their fridge. Feeling anxious, expecting bad things to happen, attitudes and actions that can help, results and rewards. But here's achievement. Yeah, this is a certificate of achievement. I don't have page 80. So either way, I guess that would be like a page where they can just write down strategies and activities that they like to do that help them. That you know, like you all shared, petting your dog, going for a walk, doing meditation, reading, listening to music. Those would be strategies that like they would put down too for the things that they like. So here's a situation that we can use an example. There's a new kid in class that would like to there's a new kid in class that you would like to get to know, but you feel nervous about talking to him. He sits down next to you in the cafeteria. What do? Are you feeling nervous? How can you tell? If you were this kid who really wants to talk to the new kid and the new kid is sitting close by, what do you suppose you would be feeling? And how would you be able to tell if you were feeling nervous? Has this happened to you before in school? Can you all describe what would go on in your body? Maybe you would have maybe different bodily reactions, but you want to model for the child, right? So what they might be saying is, I can tell when I'm nervous when my heart beats fast, my breathing is quick. I'm starting to like be like a little reluctant and second guess myself if I should really go and talk to them. Expecting bad things to happen. Tune into your self-talk. What is it that worrying you? What's worrying you in this situation? Using the example, write down your idea. Well, I'm worried that he might ignore me. I'm worried that I might be bothering him. Attitudes and actions that can help. Now list some of the possible things you could do. Ask yourself, what can I do to make the situation less fearful? So I want to hear from you all. If you were this child in this situation, feeling anxious and expecting that maybe he won't want to talk to me, he'll reject me, what can you do about it? About that feeling? Somebody has something to say.
I think it would be beneficial to explore the expected outcomes and potential outcomes. So you're saying at one point to even go to the worst possible scenario. So if for some reason he doesn't want to talk to you, what is the outcome of that? Is that going to be something that's absolutely detrimental, or is that something that you can move forward from? Which most likely is going to be yeah, I can move forward from that. Maybe it's not as bad as I thought. And then maybe looking at some expected outcomes, like if he does talk to you, or maybe a friendship can come out of it, something that could be potentially more positive, but just looking over the outcomes as a whole.
Excellent, Brandy. Yes, thank you. So yeah, what are we anticipating? And you know, are we thinking that there will be an outcome where we'll be rejected, or could there be potentially other outcomes, right? So yeah, just really examining the outcomes. Well, does anybody else have anything they want to share? They could potentially do nothing, and then maybe they wouldn't have to face that possibility of rejection, but they may also be disappointed because they never got the chance to meet that person when they had the chance to, right? To get to really know them. Maybe they can think of another time to approach them, maybe not at the cafeteria, but maybe wait till they have class together if possible. But the book talks about problem solving, and there are problem solving steps that are outlined here. So it says here on page 37 in the manual, it says, describe the problem solving steps. The therapist explains that problem solving steps help to develop a plan for coping with anxiety. This plan will be specific to the type of situation and the child's particular preference for strategies that are helpful to them. Discuss the problem-solving process by describing for the child how to develop an idea for changing something using the following steps. Define the problem. What is the anxious situation? I want to get to know this new kid in school. He's sitting next to me in the cafeteria. but I'm feeling anxious about it. Step 2, explore potential alternative solutions. Be careful not to evaluate yet. So here's where I was doing something wrong. I was quick to judge him rejecting me or, you know, not wanting to talk to me or being embarrassed. And I never really gave a chance to any possible solution or alternative because I kind of shot him down before they even came off the gate. So explore potential alternatives. Be careful not to evaluate yet. Don't evaluate yet. Just explore potential solutions. Don't be critical of any solution that's put on the table yet. What might someone do to make the situation less fearful? Then step 3 is to evaluate the potential alternative solutions. Which solutions are feasible alternatives? Do any alternative solutions not make sense or are not feasible? Usually in situations where someone wants to introduce themselves and meet someone new, they often don't know what to talk about or why someone would have even any care that they're going to introduce themselves to someone. But sometimes what may make that conversation more enjoyable or appropriate would be to like introduce yourself and relate it to maybe a common interest. Like maybe they're wearing a t-shirt of a favorite band of theirs that you also listen to, and you have now a topic of interest or something in common, right? Or just even to just have like potential alternatives and then just evaluate, some that might be more high yielding, that might be more profitable for you than others. And then step 4 is select the preferred alternative. But just this whole point here is to help them get into the practice of problem solving, to stop and think about your choices and think about and strategize how you can get the best results from your plan. The problem with a lot of kids today is that they're real impulsive, they're real quick to react without thinking. And oftentimes with anxiety, when we allow anxiety to react for us, we just sort of just find ourselves embarrassing ourselves sometimes, right? And that's why people become more and more anxious, because then like their anxiety has taken control, they embarrass themselves, and then they learn, now I should just like be more avoidant. And we want to reduce that at all costs. We want to reduce avoidance. We want to help them feel more prepared. We want to help them be more confident and come up with a plan and know how to strategize and know what to do for the next action they're going to take. So that is really how you overcome anxiety. It takes a lot of work, but it takes planning. So define the problem, explore alternative solutions, evaluate the possible alternative solutions, and then select an alternative solution, and then check to see if the problem's solved, and then it might work for you in the future. So next, you need to choose the idea that works best for you. What might happen if I choose the first idea? How do I feel about it? How can I also like calm my body down at the same time? And then now we'll go through the same process with your second and third possibilities. Ask yourself what might happen if I choose the second idea. How would I feel? And then you just write that down. You just continue writing that down, and then you write down the things you've learned so far. And you want to just role play with them. And then for the show that I can task, write down 2 situations in which you felt anxious, but then use the skills you've learned. The relaxation skills, the cognitive coping where they're reframing their thinking, and then also the problem solving steps. And you can introduce the ABC model. You can introduce all these other, the personality triangle, the catch, check, change. You can introduce all those other cognitive coping strategies too. Learning about thinking traps, reframing thinking traps. So here's their stick show that I can homework. And then in session 8, I'm going to speed up a little bit because I want to, make the most of our time. Session 8, again, is how am I doing? Now it's all about results and rewards. Remember, we want to reinforce their participation. We want to reinforce their coping skills that they've been doing here. So here, the goal of session 8 now is introduce the R step. discuss the concept of the self-rating and reward system. Summarize for the child the first 3 steps of recognizing their anxious feelings, recognizing their anxious self-talk, and applying coping self-talk, and taking some action that will help change the situation. Introduce the idea of rating their performance and rewarding themselves for efforts to cope and to stay in situations despite anxiety. So now you got to also, I like to educate clients on the cycle of anxiety, the cycle of avoidance, really. We oftentimes reinforce avoidance because avoidance feels good initially. It's like a short-term relief. We don't have to deal with that anxiety-provoking situation. But the problem with that is that in the long term, we're unprepared. And then the next time we have to face a situation, all we want to do is avoid it. That's all we're really training ourselves to do, right? So we want to reduce avoidance. We want to prepare ourselves to face those anxiety-provoking situations. And something I want to say too is that anxiety is just so challenging to treat sometimes because it goes against our natural instincts. We naturally want to avoid anxiety-provoking situations. And then we become very comfortable avoiding. And oftentimes parents can get very frustrated with their child because they want their child to do what they have to do. They want them to be responsible. They want them to go to school. Let's say the child's anxious, they don't want to go to school. Then the child gets angry and they throw a temper tantrum, or they get real upset and they become hostile because their parents want them to go to school. And now the parents don't know how to deal with that. You got 2 issues. You got their anger and you got their anxiety. And typically anger and anxiety are very closely related. Whenever somebody is being forced to do something they don't feel comfortable or prepared or want to do, then they try to defend themselves or kind of stand up for themselves, and they use anger as a way to cope with that. And that's often what happens. So we want to reduce all of that as much as possible. So we want to discuss the concept of self-rating and reward system. So what's a reward? So we'll talk to them about what a reward is. And there's different kinds of rewards, right? Talk about examples of a reward, and use a story about teaching a dog a trick. It says here in the manual, if the dog learns the trick, he gets a reward such as a dog biscuit, a pat on the head, or something else that he enjoys. But the whole trick isn't learned all at once. It takes gradual steps to get closer and closer to the complete trick. If a puppy has trouble learning a trick, his trainer tries again and again until he gets it right. Emphasize the point that in the beginning, the master might reward the puppy for doing part of the trick, and that the puppy is rewarded each time he does something right. We want to also, reward ourselves when we do something right. And let me ask you all, do you all ever reward yourself after taking on an anxiety-provoking situation? How do you all reward yourselves? Like sometimes after a long class, I'll get a Coke and I'll drink a Coke out of the soda machine. It's like a way I reward myself. Oreo milkshake. Wow, from Chick-fil-A. That sounds great. Chipotle. Yeah, a lot of us are talking about food and drink, right? Food and drink. Immediate comfort, right? A nap. A nap is good too. Yes. Reward ourselves with a nap. That sounds like a good idea. Playing games. Yeah, I'm gonna take some time to just enjoy the time, just play some games and relax. Like I get my mind stimulated on other things. But it's helpful, and we reinforce that. And it's especially true if parents reinforce that for their children. So list some type of rewards, nothing too big or expensive. Small rewards can make us feel good too. It says here, sometimes I get rewarded by other people, but I also rate myself. And when I'm happy in how I did, I reward myself. Oftentimes I'll tell myself, hey, I did a good job. Even when things don't turn out perfectly, I try to reward myself for what I did do well. For example, I might reward myself for spending some extra time grooming. Okay. So now we practice. Anika is playing for her school soccer team and scores a goal. What could Anika say to herself for a reward? So now we're going to talk about coping self-talk as a reward. What could Anika say? That was an awesome goal. I did so good. My hard work paid off. You also want to be encouraging and model this for them, but also like acknowledge them for like the hard work that they're doing in session with you. You know, I can tell you're working really hard at practicing the skill. Just acknowledging them for that, being encouraging. Jeff wrote an essay for a city contest and won third prize. How should Jeff reward himself? Maybe he can go get a milkshake, right? So anything like that that the client comes up with, as long as they get the idea that, hey, I can reward myself for the results that I'm hoping to get. Sometimes even if I did a good job, things don't work out exactly the way I planned, or sometimes I think I could have done a better job. In those cases, I still try to reward myself for what I did do well. After all, we can't be perfect. Like when I make a cake for my friend, but forget to take it out of the oven on time and it burned. I still was pleased with myself for thinking of my friend on his birthday, even though the cake wasn't perfect, right? So if it's even an okay result, but not, so have them think of an okay result, but not perfect, but not terrible either. And what could they be saying to themselves? So you want them to practice coping self-talk. Role play scenarios too. It says here, the therapist and child, it says on page 44 in the manual, the therapist and child role play a scenario involving an anxious situation that is coped with successfully, not perfectly, by the tag-along procedure as necessary, or use the tag-along procedure as necessary. Tag-along means like you're going to join in on this situation and help them, coach them on how they cope with it. Examples of possible self-rewards are included. Finally, the child role plays a similar scenario with less of the therapist's guidance. Remember that it's not enough to talk about these issues. Provide the opportunity for real practice by orchestrating in role play activities. You have to get creative here. It's very important that you can do this to help encourage them. Like role play scenario where they're walking in the hallway during passing period and there's a lot of loud noises and you're one of those loud noise kids. Role play a scenario where they're in class and they have to take on a challenging assignment, maybe explaining something to another student or anything that comes. And then try the feelings barometer. So what it says here in the manual on page 46, review the fear hierarchy and discuss exposure tasks. Now you're going to talk about more exposure tasks. The therapist informs the child that the next session involves practicing the skills that we've learned. We'll go places and do things. The following information may need to be discussed with the child. The fear steps, feeling anxious, expecting bad things to happen, attitudes and actions that can help, results and rewards. Situations identified in the situation cards and fear ladder in the Cope and Cat workbook should be used here. Practicing these steps in situations that provoke genuine anxiety allows the child to see that they can cope, to find out that what they thought was going to happen in a situation is unlikely to happen. So you want to also help them see realistic, more reasonable ways of thinking about what'll happen, right? The practice will be carried out in a gradual way. Take your time, be patient, go at a good pace. The aim of treatment is not to remove the child's anxiety, but to reduce it, like lowering the volume down, like going from like a high volume in a radio to like a low volume, to like from a 10 to a 2. That's sort of what we're doing with their anxiety. Practice the fear steps repeatedly. And then depending on the exposure task, the child may need to stay in the situation for a certain duration of time. And then there's going to be an upcoming parent session again. But tips for session 8, for older children, use analogies that are relatable, such as a commission for effort sales at work, or bigger and longer contracts for sports players based on performance may be useful to introduce a concept of reward based on effort. So you're introducing the concept of reward based on effort. Encourage the child to feel proud of their accomplishments. It takes a lot of effort to come into counseling week after week, be faced with these anxiety-provoking situations. and then have the courage to continue working through learning skills to cope with them. That should be very highly acknowledged and made to feel proud. They deserve that. Reward the child for their effort thus far in the treatment sessions. Let them play a game, give them a snack. Encourage the child to reward themselves with positive self-statements. You want to get them into the practice of doing that. And then explain the 4-step coping plan to their parents, the fear model. Explain that to their parents. So they go over these worksheets with you. They make their fear plan card, which is at the end of that curriculum. And they just learn about coping self-talk. They have another show that I can task, but here they go through the same thing again. A time when they were nervous. How did their body react? What were they thinking? And then what were the attitudes and actions that they used to cope with that? And then did they reward themselves for that? And then you have a parent meeting. And in the parent meeting, it's a lot of the same stuff again. You provide additional information to support the parents for how they can approach their child. Give them opportunities for rewarding them. Learn more about situations that they've become anxious, and just help it, evaluate how they're doing. And then more tips here for session 8. For session 9 it says here, or just tasks. Yeah, just kind of coaching the parents on doing all these things. And then it continues where in session 10, now you're practicing more. And here's what I want to say with practicing. Practice anxiety-provoking situations. I often have kids that struggle with social anxiety, and they often struggle being in crowded places around a lot of kids. So if parents give you permission, go with this child somewhere during a period of time during the day where it's not too crowded. Like, for example, I have a client who is very scared to talk to people, and he's very scared to come across people. And he gets a lot of anxiety when he's around a lot of people, right? And so we started going to like Walmart. We didn't go to the mall yet. We started going to like Walmart, but at hours during the day that is like more like less busy. And you can usually see like the hours of how busy stores are when you Google them. And so that was helpful. Just walking in the store, maybe modeling for them, like asking how much something costs or where can I find this item, right? Getting them more comfortable to talk to people in social situations. Talking to a cashier can be really uncomfortable for a lot of clients, for a lot of kids. So just getting comfortable talking to a cashier, model that for them. Hey, how's your day going? Long day when you get off work. And then have them practice doing one thing like, how's your day going? And then they can gradually get more comfortable. I've taken kids to the mall at a more busy hour. And then we would, first rate their level of anxiety. What's that feeling thermometer at? Like, how do they feel on that subjective unit of distress scale? Practice coping, relaxation, have them go through the fear model. Am I feeling anxious? What's my body doing? Am I expecting bad things to happen? What am I expecting to happen here at the mall? What are the attitudes and actions that can help me? Well, no one's probably paying attention to me. They're probably just more concerned about like what they want to buy. That's a better attitude, right? And then, have them just be there, support them, and have them like practice. The more that they're around anxiety-provoking situations, the more they should be rewarded, because then they build that tolerance like, hey, I can handle this. I'm doing this well. And then they are able to like maintain that threshold. Like, I can handle being around anxiety-provoking situations. I'm more comfortable. Typically, when we jump into a scenario that's anxiety-provoking, we're nervous right away. Our anxiety's higher. But the longer we've been there doing it, we're like more and more relaxed. It's kind of like giving a presentation. When you initially start out, you're worried, but then as you remain doing it, you're more and more relaxed. We've been desensitized. So then you go through these steps with them. Again, go over the fear model, and then have them rate their anxiety. And then you gradually ladder up to a more anxiety provoking situation. Whereas, you try to make it a little bit more intense the next session, but of course, make sure that they know how to implement the coping skills and the strategies for helping them. And so that's session 11. It's a lot of the same thing. They keep practicing, but now they're practicing a more anxiety provoking situation. And then session 12, more practice. Now you're doing from easy situations to medium situations. Not easy, but not too challenging. And then it says here, they pick a medium situation, describe how they feel in that medium situation. It's a lot of just going over the FEAR acronym again. FEAR acronym, how are they doing? Using problem solving skills. It's getting tougher. Now they're having to deal with more scary situations, like the mall example is a more scary situation, right? But try to get them to practice real life scenarios and have them practice a plan for how they're going to deal with this scenario. And so it repeats itself, and that's the end. That's at the end. That's session 13. And then session 14 is let's practice some more. You talk about more challenging situations. Fear model again. They take another chance to practice. Here they're talking about a commercial idea where the curriculum wants them to record a commercial where they actually kind of tell their story about how they used to be very anxious for things. Now the client's talking about how they've progressed, and it's kind of like they're telling a commercial about their success. Remember we talked about you doing an ad or a song or a poem or whatever to teach others how to cope with anxiety? Use the space below to do some sketches or write down some ideas. I have a lot of kids like write songs, and they'll even record their songs, and they'll even like rap a song, on how they used to feel and how they overcame it. So something encouraging and motivating that they like to do, or if it might just be like a quick message of what they'd want to do. I try not to, actually like record them though. Like I don't really do that at all. But if the kid wants to record like a song to remind themselves of what they've been through and how they've coped, we'll do that. But a lot of it now is just role play. Get them to just be familiar with the fear model. Am I feeling anxious? What is my body doing? Am I expecting bad things to happen? What am I thinking? What can I say to myself to cope with this? What are the attitudes and actions that can help me? How can I come up with a plan and a strategy following the problem solving steps to cope with this anxiety provoking situation? And then how can I reward myself actually for sticking it out and going through this and doing well? And you just continue doing this as you model coping strategies, as you reinforce support, as you coach the parents for supporting the child, modeling that as well for them for how to cope with stressors. And you just continue, you go on. Session 15 is the same thing. So let me jump ahead to some of the tips for session 15. Provide the child with a final reward for participation. The therapist discusses with the child's parents how to support the child and what they've learned. Playing games, yes, playing games is helpful too. That's a great strategy for rewarding. So we have a few minutes left now. I just wanted to ask you all, does anyone have any questions or any scenarios come to your mind when going through this, going through this curriculum? Anything you want to ask or anything that you're curious about? Would you all use this curriculum? Anything that you feel like this curriculum really does well? Great, I'm glad. Do you think the worksheets would be helpful in the show that I can tasks and the fear model? What do y'all think about the fear model? Pretty simple. but it's pretty effective still.
It's a really good acronym to use, especially when you're working with younger clients. It breaks it down a lot more.
Yeah, it's very easy to remember, simple to understand. Yep. So this curriculum has a lot of great resources. There's a lot of great things that it talks about too. Talking about the manual now. The manual has a lot of great information about how to deal with comorbidity issues like depression or dysthymia on page 84, hyperactivity 86, obsessive compulsive patterns 87, panic attacks 89. You definitely want to go over relaxation techniques and exercises with them, help them see that they can take action to reduce the physiological response of anxiety and promote more of a relaxation response. And then there's good recommendations on page 90 on how to deal with compliance issues or hypercriticism and how, where did those thoughts come from? Like whenever we have hypercritical clients, like I ask them like, where did those thoughts come from? And are they really helpful? And are they really true? And sometimes we adopt thoughts that, people have said to us. And we need to be mindful of that. How to deal with kids who deny anxiety, but yet demonstrate it anyway, especially demonstrating avoidance. Oftentimes they want to save face. They don't want to be vulnerable and show that they're scared. So they deny having anxiety, yet they still avoid a lot of things. How to deal with school refusal, working with avoidant children, working with parents of school avoidant youth, how to deal with realistic fears. That's on page 95. Family difficulties, 96, talking about like parental separation issues and stuff. But I want to just thank you all so much for your participation. I hope that this curriculum was helpful for you all. And now we're going to shift gears and we're going to go into another activity. And Ashley and Melanie, you can take it over now. But thank you all so much.
Awesome. Thank you, Dr. I. So if you'll go ahead and get the simulation video pulled up, I can go ahead and go over the case study real quick, just kind of give y'all some background information on the client y'all are about to see. So Sam is a 13-year-old who has been experiencing separation anxiety from his parents over the past 4 months. Both of his parents contracted COVID about 7 months ago and were in the ICU for 3 months prior to making a full recovery. During that time, Sam had to stay with his grandparents, and since his grandparents don't live in the school district, he had to go back to virtual learning, even though he had been face-to-face, after schools opened back up again. He reported that when virtual learning had happened at his school, he was not able to learn well and fell behind. He actually ended up being held back a grade level and now is taking 7th grade for the second time. He's back to in-person learning after his parents had recovered. And anytime his parents or Sam have to leave the house, he mentions he feels that he is going to throw up and his heart starts pounding. He stated he begins to have thoughts that he won't see his parents again and they're going to get sick and die. Sam's parents admitted he started to sleep in their bed despite being 13, and he has also been wetting the bed at night. While at school, Sam is constantly getting into trouble for having his phone out, texting his parents. He no longer engages in any after-school activities because he wants to get home to his parents. He has been missing classes so he can go to the office and call his parents when his phone gets taken away in class. On the weekends, Sam requests that both his parents stay home with him, and he refuses to go to his grandparents' house by himself in fear of his parents not returning to pick him up. Sam's parents decided to seek out counseling for Sam when they noticed the bedwetting 4 months ago. Sam has now been seeing his counselor for 11 sessions.
Okay. So can you all see this? Give me a thumbs up. Okay, perfect. So rather than stopping the video and kind of processing through it as we have been doing in the past, we're going to go ahead and play the whole video. So as you're watching it, feel free to take some notes. If you have questions that come up for you, write down your questions, and then we'll kind of process it together as a group at the end. Sound good? Okay. Give me a thumbs up if y'all can hear the volume. Whenever y'all are ready.
Hi Sam, how have you been this last week?
I've been better. Today I was able to get through up to my fourth period class without having to call or text my parents or anything. But after lunch I started to get that feeling again.
Oh, okay. What feeling?
Like that something bad was gonna happen to my parents.
Okay, so like you felt proud of yourself because you know what? We made it past fourth period before lunch. And then you started to think something bad was going to happen. Does that sound about right?
Yeah, I don't even know why it had happened because I was having a pretty good day until that thought popped in my head.
Okay, tell me what that thought was.
I just thought that something bad was going to happen to my parents if I didn't call them.
Okay, so what did you feel like when you started having those thoughts?
Oh, well, my stomach kind of felt like it was like knotting up, you know, and
okay.
I started sweating and I got dizzy and it just felt like I was gonna pass out.
Okay, so it sounds like you're having your normal physical response. What specific thought or thoughts did you have?
I don't know, I was just thinking that like if maybe something bad happened to my parents again and they're like maybe they got in an accident and just nobody told me and I don't know, I just thought that I wasn't gonna see them again.
So you're scared?
Yeah, I was really scared because like I don't like to like not see my parents and I don't know, I don't want anything bad to happen to them.
Well, yeah, I mean, I can see how that can be scary for you. Like you were away from your parents for a long time and you couldn't talk or see them, and now you're afraid that could possibly happen again.
Yeah.
Okay. So I was wondering if you've been able to work on some of the skills that we've talked about in our past sessions. When you've had those thoughts of anxiety or while you were in the moment of having anxiety?
Not really. It was hard to remember everything when it was happening, but afterwards I was able to remember most of them.
Okay, so tell me what happened.
So I started getting the feeling again and I asked my teacher if I could go to the nurse's office and I was in there for about 15 minutes and I was talking to my parents. Then I went back to class. I missed my fifth period class, but I was able to go the rest of the day without like needing to call or text them.
Yeah, well that's definitely progress. I mean, you remember where you were when we first started? Like 4 months ago?
Yeah, it was I was like calling them and getting out of class to call them and text them like every hour.
Yeah, I mean, you've come a long way. I'm wondering what it's like for you to reflect back on where you were then versus how you're doing now.
Yeah, I mean, it's kind of hard to like. It's nice to think like how much better I've been doing, I guess, compared to like now and back then.
Yeah, I mean, it's tough to recognize how far we've come when we're dealing with discomfort still, but we still have to be gentle with ourselves while we're making that progress.
Yeah.
And with that being said, let's talk about your stick assignment. Did you complete that this week?
No.
You seem to be a little anxious telling me that.
Well, I just don't want you to be mad.
I'm not mad. I mean, I wouldn't be mad. These assignments are for you, and these exercises are your choice whether you want to do them or not. I mean, I know since we started with the workbook and everything, the sticks assignments you haven't really been completing. Is there a reason why? Can you tell me some more about that?
Well, I mean, I just have so much homework for school, and I don't want to fail 7th grade again. So by the time I'm like done doing all my homework, I just don't want to do anything else. Besides, you even said I've been making like a lot of progress, and that's without me even doing most of the stick assignments. So
yeah, so you're getting run down, doing homework, and not wanting to do anything else, and you think since you've been making progress that you no longer need the stick assignments. Is that right?
Yeah.
Okay. I understand that, and I know it's difficult to keep up with like homework and the stick assignments and therapy and everything that you have, but on the other hand, you have to take some time and put some effort into your mental health. It's one of those things where you only get out the work that you put into it. And remember, that's just how counseling is.
Yeah, I'm still probably not gonna do them.
I mean, that is totally your choice. And all I can do is encourage you to try. Are you ready for what I have planned for us today?
Do I have a choice?
I mean, you do. You always have a choice what we do in here, but I thought we could talk about fear. Your fear working.
Okay, yeah, sure.
Okay, awesome. So, you've already learned how to identify your thoughts and your feelings in your body about how it responds to anxiety. So, you also have learned the steps of coping, which is what fear is. So today we're going to practice fear a little bit more. Are you okay with that?
Yeah.
Okay. Do you want to go, let's start from the beginning. So, F stands for feeling frightened, right? So, identifying what you are feeling, and this is the first step in how you cope with those situations of being anxious. You recognize what your body is feeling tense or worried about something.
So like when I was feeling like dizzy and like my stomach got knotted up?
Yes, exactly. Exactly. Do you remember what the next step is?
E is like when I think something bad's gonna happen to my parents?
Yes, correct. So expecting bad things to happen. This would be recognizing the thoughts that are making you anxious or tense.
Okay. So, yeah, so like me thinking like something bad's gonna happen to my parents. So.
Yes.
Okay.
Yeah, exactly. So what about A?
I don't remember the last two.
Hey, that's okay. Remember, A stands for attitudes and actions. So this refers to thinking about something that can make the situation less fearful. So what do you think you could do in those situations if you're feeling anxious or tense to relieve some of that?
Maybe I can take some deep breaths.
Does that calm you down?
Yeah, sometimes.
Okay, then yeah, taking deep breaths could be really beneficial for you. So let's go ahead and move on to R, which is the fun part, rewards and results. So this is the last step of coping with anxiety, and it just means rewarding yourself when something that you do has positive results. For example, you today not needing to text your parents until after fourth period, that deserves a reward. What do you think would be something that you would like for that?
Maybe I can give myself 10 more minutes on my Xbox?
Hey, I mean, if your parents agree, that seems like it would be a great award. It seems like something that you can really help you get motivated, and it is important to keep those rewards in mind. And you gotta remember also, it's as simple as telling yourself a good job.
I think I'll stick to the Xbox.
Okay. Well, if it works for you and your parents, then that sounds like a plan. So like I said earlier, we're gonna do some more practice today, so are you up for that?
Yeah, sure.
Okay. So if you go ahead and turn to page 48 on your workbook, there is a spot for us to pick a scenario where you can draw a character cartoon about coping with that situation. So which scenario would you like to do?
Let's do this first one.
Okay. Can you read it out loud, please?
Drew has a math test tomorrow, but he's nervous he's not gonna pass because he hasn't been doing well in class, and he thinks he might fail.
Okay. So let's draw out how you think Drew could cope with this. Okay?
Okay. Okay.
Okay, cool. Tell me what's happening in it.
So Drew is nervous that he has a big test tomorrow and he thinks he's gonna fail. So his stomach starts hurting and he's kind of freaking out. But he stops. He takes some deep breaths, and then he feels better and says, "I can do it."
Okay, awesome. Good. Let's act it out.
What?
Only if you're comfortable. You're going to pretend to be Drew in this situation and act out the cartoon strip and see the results. Are you up for that?
Yeah. Okay, sure.
Okay, remember, it's only if you feel comfortable, and if you need to stop, we always can. Just let me know, okay?
Okay. So I just acted. Okay.
Just whenever you're ready, just go ahead and stand up and act out the cartoon.
I have a math test tomorrow, and I'm not ready. I'm gonna fail. Wait. I can do this. I just have to study.
Okay, awesome, Sam. What was that like for you?
It was nice. I mean, Drew was really nervous that he wasn't gonna do good on the test, and some of that like anxiety was real, but the deep breaths really helped me like calm down, I guess.
Yeah, I noticed you were a little anxious when I mentioned that we were going to do this. So like, it sounds like you were able to experience some relief with it too.
Yeah, it's nice. The anxiety doesn't really last as long as it used to, I guess.
Yeah, well, I'm glad to hear that. You are doing much better.
Yeah, it's really nice to like be able to handle things a little bit more now.
Yeah, and you put in the work, so you got to keep it up, and you will get where you need to go. Speaking of that, do you know what time it is?
Yeah, time for you to give me my STIC assignment.
Yeah. Well, that's all right, and I know it's not your favorite part, but we are here to these activities to get progress. So this week, I'm gonna have you practice using your fear tactics like we just did with 2 situations. So that make you anxious. So you'll just describe each step of the plan as you used it and write them out for me. So does that make sense?
Okay, yeah.
Okay, great. When you come back next week, we'll talk about it all and we'll go over it again. Do you have any other questions?
I don't have any.
Okay, cool. So I will see you next week. Have a wonderful weekend, and I'll see you next time.
Awesome, thank you.
You're welcome.
Okay. So, what are some things that kind of stuck out to you all, either in terms of the client, their interaction, some of the coping cat curriculum that we've gone over? General thoughts.
And let's try to hear from someone that hasn't really had a chance to speak up today.
I like the way that he said that he wasn't going to do the stick assignment, but then she practiced with him, and so he kind of changed his attitude towards that.
I liked how the counselor gave the client time to process after he did those activities and asked him about how that was for him, like the reflection period.
So if you were this counselor, what might have you done differently?
Maybe I would have explored more on what kind of thoughts he was having that something bad was going to happen to his parents.
And how might you have done that, Julie?
I would ask him what kind of thoughts was he having that was something bad was going to happen to his parents, and what was triggering it. What was he feeling? What was he thinking?
Good, thank you. Who else? All right, so I guess I'll just start calling on people. So let me see who I see first. Becca, what's something that you may have done differently or something that you noticed while the video was playing?
I don't really know what I would have done differently, but I did like the role play. I know that's something that I haven't really done too much with like patients I've seen, but I think like seeing it out within like the video, I liked it with how she was able to like encourage him to do the role play and then how they processed it. So I thought that was helpful, at least for me to kind of see it in action.
Awesome, thank you.
Yeah, I agree. And also, like Julie said, I would try to like explore what those thoughts look like. So like maybe ask, you know, what is your deepest fear about it? Like what's the most terrifying thought that you have about this, and how realistic is that, you know, that outcome or that this thought will come true.
Awesome, thank you, Lana. Jolie, what about you?
I was just thinking, I would have explored earlier in the role play when he said that he believes that if he doesn't call his parents, something bad would happen. It sounded almost like a compulsive, like a compulsion, I guess, an OCD of like him having this fear and then ridding the anxiety by performing that action. That would have been something that I think I would have gone back to touch on.
And what would have been like the purpose of you going back and touching on that?
Well, if it is OCD and not just general anxiety or social anxiety or something like that, then I think the treatment approach would change. And as a clinician that's not experienced in OCD, or, you know, I would want to maybe do some sort of OCD item assessment to figure that out and kind of maybe remap a treatment plan. I'm sure that in the case that OCD was more of the case, like the, I guess, diagnosis, that the coping cat skills would be helpful in like kind of tolerating the distress and having coping mechanisms, but it may need to change the way that we're conceptualizing like actually what's going on.
Awesome, thank you. And let's hear from one more. Alyssa, what are your thoughts?
Sorry, I don't feel good right now, so I'm typing in the box. I'm not ignoring you.
Okay, no worries. While you type, then let's go ahead and hear from Lizette.
As for what I would have done differently, I know I said that I liked processing and giving him time, but I think bringing it back to like right now I'm working with an adolescent, and there's moments where I allow for like more moments of silence and more time for them to process. So maybe just adding more time or room for silence and them to process, as well as me, because sometimes I don't know where to go from like to move on from what we talked about. So kind of giving me as a counselor to the moment to process more of what's going on.
Good. So, you know, the whole purpose of TexCHIP, right, is to help y'all work in integrated settings. And so, since y'all, well, I know not all of y'all are still kind of getting those hours, right? But for those of you who are like already enmeshed in your integrated setting, how might this like this activity or this curriculum be helpful in the settings that y'all are in? Or how might you use it in your settings as far as incorporating the other disciplines within your sites?
Well, I just barely started on Senecor finally. I'm just doing the trainings right now, but I think that because of his stomach nodding and passing out, probably will have the nurse or assess him, or maybe even the doctor, you know, because it could be something else, totally healthy wise instead of anxiety wise. So.
I think, well, my site is Turning Point MHID. So our integrated hours are actually in like the crisis intervention unit, shadowing a nurse. Or not shadowing, but also interacting with clients and stuff as well. And I find that a lot of the clients that we see really don't have much knowledge of like things that they're able to do, kind of like what Tim was talking about earlier. And so I think because they're looking at the medical side as the primary place that they're getting help. So clients are expecting to get some sort of anti-anxiety when they come in, rather than be equipped with skills that they can do on their own to kind of help manage that in addition. So that's kind of been my experience. I do not remember now after I started talking what the question was fully. But that's, I think if we're integrating this, that's what it was. This curriculum can be helpful in providing some sort of like structure for what psychoeducation can look like in conjunction with medicine, which is really helpful. That's what most, I guess, research recommends, is doing counseling with medicine.
I'll add something in that I don't, while you, the way, the scenario I'm thinking in my head here, may not be able to use the entire session things. These are the core concepts from there can be used in things like helping with adolescents who are going through medication regimens with providers, whether it be long-term illnesses, autoimmune things, where they may be having to address some medication compliance concerns, or the way that affects them on a personal level, and how they interact with their peers, right? There's a lot of processing that has to go through a lot of that, especially like one example could be like an adolescent who has to use an insulin pump and what that means for them. You know, as much as we love the medical side for being who they are, they don't have the soft skills training that we do. And that can be very valuable to helping them overcome a lot of potential traumatic experiences, how to help process what that means, and how they're going to carry it forward. So even if you're not going to have the full 16 session opportunity here, the same skill set that we're learning today is transitional through, or carries through all of these different scenarios that you can think of, where we may be pulled in different environments for just small, quick windows. Like if you're in a hospital environment, you could be pulled in to help with just some grieving, or you could be in for the compliance aspects. So yeah, taking snippets from here and even the role playing elements, that can still be a great thing for somebody in that scenario.
Yeah, for sure. So instead of, like you said, different settings where you may not have access for a consistent 15 weeks, right? We can still kind of pick and choose what tools or what skills or what activities that we use without having to go through the whole curriculum. Yeah. So my last question for y'all is just, what questions do you have, whether it be about like watching the specific role play or just any other questions y'all might have thought of for the coping cat curriculum, that y'all had maybe thought of whenever we were doing the simulation.
I had a question about the coping cat manual and the workbook. Is that only for anxiety, or did it cover, or there's other ones for anger?
That's a great question. I should have shared this earlier. There's the coping cat for young children with anxiety, and then there's the cat project, which is also made by Philip Kendall for anxiety with adolescents. But for depression, there's the Taking Action curriculum, and let me see if I have those books here, and the Taking Action curriculum is also a book made by Philip Kendall and Kevin Stark, and it's similar, but this is for young children with depression and depressive disorders. So it's its own curriculum. It's called the Taking Action curriculum. It's similar to the Study Team workbook, and then there's this one here for impulse control by Philip Kendall, and this is called Stop and Think. And the Stop and Think curriculum is a 20-session curriculum, and it's all about helping them stop and think and solve problems. Like they have mazes and things like that they would do to learn how to stop and think about their choices. Does that help answer?
Yeah, I guess. I have a 9-year-old. I think we are on a 13th session, and he was doing very good regarding anger issues, but it seems like he's going back. So that's why I was wondering if there was a specific workbook for anger.
So there are, depending on what you want to do. If you want to teach them like anger management coping skills, then like one recommended curriculum is the skills. It's called skills streaming. And then there's also aggression replacement training. That's for like adolescents. But skills streaming, there's a lot of good like anger management curriculums, but Philip Kendall, like the author of this curriculum, doesn't have one specifically on anger, but this Stop and Think could be pretty helpful. But anger is oftentimes a result of anxiety when they're anxious and they're being forced to do something. Yeah.
Okay. Thank you, Dr. Allen.
You're welcome.
All right. Any other questions about our training for today on working with anxiety? Okay. So I'm going to go ahead and